Hello, good afternoon. So I hope Gnm students, you are eagerly waiting for the today's class. Actually, my sound is little bit tough and rough. That is because of cold and fever. The last 1 week I had cold and fever, so that's the reason I lost my voice. Again now it's okay, so that's the reason again I start with the live sessions. So if you feel any type of difficulties with my sound, means just forget that, because it is because of the cold. Okay, actually I'm on voice rest also. Okay, all right. So as GNM students, you can send your concerns in the live chat. Definitely we will address you, because your exam will be start from this December 29th onwards. Is it? So my voice is audible or not? I want to know that. So just write it in this live sessions. What about my voice? Is it clear? Okay. Hi. Yes, this is GNF first year. GNF first year, first subject, that is bioscience. So today I'm conducting, not only me, one more teacher is there. So we are conducting live session on GNF first subject, that is bioscience. In that bioscience, we know that anatomy, physiology, microbiology is there, 3-hour exam, and out of 75 we need to get 50% above mark for the minimum pass mark. Okay, so what about my voice? Just write it in this live chat. Okay, so I think maybe you are also aware about that. Last time for the BSc and post BSc students, we conducted live sessions. Okay, that we got lot of messages from and through the Instagram, and as well as directly we got lot of messages. That was very useful, and also 99% of the questions came from our previous live sessions. So that's the reason this time for the GNM students also we are confidently conducting the live sessions, and in the end of sessions we will give you the most important questions, means the prediction. Exam question paper predictions are there, so don't forget to watch that one. Okay, clear. So initially from the initial class time we are discussing about the syllabus. Okay, syllabus and important questions, how to write, and also how to draw the diagram, everything we will discuss there. And after that about the predictions also we will conduct. Clear? Okay, so if you are watching, if you are a GNM students, okay, if you are a GNM students, definitely share with your friends, and mostly maybe okay, കേൾക്കുന്നില്ലേ സൗണ്ട് കേൾക്കുന്നില്ലേ? ഹലോ, കേൾക്കുന്നുണ്ടോ? സൗണ്ട് കേൾക്കുന്നുണ്ടോ? സൗണ്ട് എങ്ങനെയാണ് അതൊന്ന് പറയണേ. ഓക്കെ, സൗണ്ട് കേൾക്കുന്നുണ്ടെങ്കിൽ ഒന്ന് പറയണേ. Okay, we know that in the yesterday we done one post or story in our Instagram. So regarding which language do you need the exam revision preparation class, like that we asked. Total 65% of the students they are voted for Malayalam classes, and 28% of the students are voted for English, and 7% of the students are voted for Kannada. Okay, so that's the reason in this today's class we will talk in both Malayalam, Kannada, English, everything. So you can write anything, you can write in the chat box, we will discuss. Okay, so total I think 3,779 students are voted for Malayalam. Okay, actually it was a good response. So what about the sound? What about my sound? Okay, now it is okay. Okay, can we start? Okay, before starting for this class Swarnashree ma'am also is there. Ma'am will be joined.
Good evening everyone. So most awaited class.
Yeah.
Everyone are awaiting.
We are just started.
Yeah.
Simply started.
GNM.
So dear students, just share through your friends groups and all. Only 12 members are there. Yes, first year GNM ആണ് class. First year GNM ആണ്. നമ്മൾ full class discuss ചെയ്യും. You can speak in Kannada also because Kannada students are there. So you speak in Kannada. I will talk in Malayalam also.
Okay.
And we can ate. Karnataka University, mostly important questions are you? First year
mostly,
in Karnataka University, Karnataka KSDNB questions only we are discussing. Karnataka examination board questions revision we are doing. Okay.
Yeah, what we are doing means we are doing and we are analyzing previous year question paper, and as well as we have analyzing the important topics according to your curriculum. Curriculum anta helidre, that is what the syllabus. Okay, so as the base is the syllabus, so on top of the basic of syllabus only we are going to discuss each and everything and the expected things for your examination. And I can proudly say that who are watching our lives, once they are seeing the question paper, I have attending the examination duties. Really students are very happy, feedback is very good. Thank you so much for those things. And once again I can tell this is very much important and boost up your knowledge at last of your examination.
Yes, and then they can also memorize their knowledge because last 1 year you have studied. This is for the GNM students, so not a semester, it's a year based. So last 1 year you have studied about all those things. Now this is the time for examination. Definitely for the first year students you have tension. Okay, before the examination, definitely everyone, how much you have studied also you have tension. So if you are attending the sessions, definitely we will clarify your concern and all. So first of all, we can start with our syllabus. So basic syllabus regarding the first year total 5 subjects are there, but 4 exams are there. Yes. What are the subjects?
Bioscience.
Bioscience.
Bioscience will be there. In that we are mainly going to study about anatomy and physiology. That I will explain you what you have to study in the first and foremost thing. Today the entire class is all about bioscience. Okay, so when it comes to the bioscience, again we have 2 sessions in
3 sessions, anatomy, physiology
and microbiology. That also will be there, and including in that particular subjects we will study majorly these 3 subjects.
Exam is near, right? So please say mostly important question. That is very useful. Mostly important questions ആണ് നമ്മൾ ഡിസ്കസ് ചെയ്യുന്നത്. ജസ്റ്റ് ഈ ക്വസ്റ്റ്യൻസ് ഇങ്ങനെ 1 by 1 പറയുന്നതിന് മുമ്പായിട്ട് നിങ്ങളോട് എന്താണ് നിങ്ങൾ പഠിക്കേണ്ടത് അതാണ് ഇപ്പോൾ ഡിസ്കസ് ചെയ്യുന്നത്. അത് ജസ്റ്റ് പറയത്തേ ഉള്ളൂ. അതിനുശേഷം ഓരോ യൂണിറ്റിലെ ഇമ്പോർട്ടൻ്റ് ആയിട്ടുള്ള കാര്യങ്ങൾ നമ്മൾ പറയും. സോ നിങ്ങൾക്ക് ഓവറോൾ ഒരു റിവിഷൻ ആണ് ഈ ക്ലാസ്. ഇറ്റ്സ് എ കംപ്ലീറ്റ് റിവിഷൻ. Not only regarding the questions. If I am telling this is the one question, this is the one question, means it is not useful. So this is the final test. After 1 year, this is the final test. So that's the reason you have to aware about your syllabus also. Okay, so first
we can briefly go with the syllabus review of your first year syllabus. Students, you make sure to understand the things very clearly. Okay, why? Because most of the students are not having the syllabus copy with them, so that will be again error. Okay, so that will makes you to struggle more. So for that reason, whatever you want to study, it may be any subject, go with the syllabus copy. That will be acts as a blueprint, and the design will be for your framework for your study. Okay, so hope you guys are understanding what I am telling. So kindly go through the things which is very important. Today we have going to discuss about this bioscience. Under that I told you anatomy, physiology and microbiology will be there. Okay, later we can discuss deeply about the subject. Okay, after that next subject, okay, the second subject is behavioral science.
Behavioral science that include 2 different subjects, that are psychology and sociology. Next, nursing foundation is it.
So under the behavioral science, we are going to study about the psychology and the sociology. And the next thing what we are going to study, that is nursing foundation. It is the fundamentals of the nursing, the basic key concept what we are having in the nursing. That is what we are going to study. Okay, it will be acts as a basement for your career. Okay, so this is one of the very important subject. That
nursing
is what
foundation is there, and one more subject, that is community health nursing. Other than that, nutrition you have to study, first aid also we need to study, but it is not a separate examination. The examination togetherly only conducted. So for the first year students, you have total 4 examination. That is, first one is behavioral science, second bioscience, second is behavioral science, third is fundamentals of nursing, and the last one is community health nursing. അപ്പോൾ നമ്മൾ ഇന്ന് സംസാരിക്കുന്ന എന്തിനെ കുറിച്ചാണെന്ന് അറിയാമോ? ഇന്ന് സംസാരിക്കുന്ന ബയോസയൻസിനെ കുറിച്ചാണ്. ബയോസയൻസിൽ ഏതൊക്കെ സബ്ജക്റ്റ് ആണ് നമുക്കുള്ള? അനാട്ടമി, ഫിസിയോളജി ആൻഡ് മൈക്രോബയോളജി. സോ നമുക്കത് സ്റ്റാർട്ട് ചെയ്തേക്കാം. ഓക്കെ, യെസ്, ബയോസയൻസ്.
next one is microbiology, in this only.
Yes. Microbiology.
So far we know that we have a subjects like bioscience, behavioral science, foundation, community health nursing, including the nutrition, few topics you have to study. Okay, so these are the major things, subjects we are going to study in this particular course. Okay, first year GNM. Next
and one more thing is there, you have different type of questions. For the GNS students, last live maybe GNS students also they watch the live. In that session we tell that essay, short answer, very short answer. But for the GNS students, they have essay, short answer, and one mark
short note kind of questions,
and 1 mark question, and filling the blanks.
Fill in the blanks and meaning of the particular.
That is 1 mark question. Define. So these many questions are there. So here you can see that anatomy, physiology, microbiology. These are the 1 questions. Because define anatomy is 1 question, define physiology 1 question, define microbiology is another question. So define anatomy, any of the question, definitely idine edengilum oru chodyam undavum. So define anatomy. What is define anatomy? What is anatomy? Anatomy means is the study of structure of the human body. Study of structure of the human body. അത്ര എഴുതിയാൽ മതി, നിങ്ങൾക്ക് മാർക്ക് കിട്ടും കേട്ടോ. സ്റ്റഡി ഓഫ് സ്ട്രക്ചർ ഓഫ് ദ ഹ്യൂമൻ ബോഡി ഈസ് നോൺ ആസ് അനാറ്റമി. അനാറ്റമി എന്ന് പറയുമ്പോൾ എന്താ നമ്മൾ പഠിക്കുക? സ്ട്രക്ചർ ആണ് പഠിക്കുക. ഓക്കെ, നെക്സ്റ്റ് ഫിസിയോളജി. വാട്ട് ഈസ് ഫിസിയോളജി? ഫിസിയോളജി എന്ന് പറഞ്ഞാൽ ഈ പഠിച്ച അനാറ്റമിയിലെ സ്ട്രക്ചർ എങ്ങനെയാണ് ഫങ്ഷൻ ചെയ്യുന്നതെന്നാണ് പഠിക്കുന്നത്. സോ ഫങ്ഷൻ ഓഫ് ദ ഹ്യൂമൻ ബോഡിയാണ് ഫിസിയോളജി എന്ന് പറയുന്നത്. മനസ്സിലായോ? ഫങ്ഷനാണ് ഫിസിയോളജിയിൽ, സ്ട്രക്ചറാണ് അനാട്ടമിയിൽ. ദെൻ വെൻ ഇറ്റ്സ് കംസ് ടു മൈക്രോബയോളജി, മൈക്രോബയോളജിക്ക് ഇതുമായിട്ട് വലിയ ബന്ധമൊന്നുമില്ല. മൈക്രോബയോളജി ഒരു ഡിഫറെൻറ്റ് സബ്ജക്റ്റ് ആണ്. പക്ഷേ GNM സ്റ്റുഡൻസിന് ഈസി ആക്കാൻ വേണ്ടി മൈക്രോബയോളജിനെ ഇതിൻ്റെ ഉള്ളിൽ കൊണ്ടുവന്നിട്ടേക്കാണ് ബയോസയൻസിൽ കേട്ടോ. അപ്പോൾ ഈ മൈക്രോബയോളജി എന്ന് പറഞ്ഞാൽ എന്താണ്? മൈക്രോബയോളജി എന്തിനെ കുറിച്ചാണ് പഠിക്കുന്നത്? മൈക്രോബയോളജി ഇസ് ദ സ്റ്റഡി ഓഫ് microorganism or microbes. Study of microorganism or microbes is known as microbiology. So ഇത് കാണുന്നവരെ definitely 3 മാർക്ക് നിങ്ങൾക്ക് കിട്ടി. Okay, so 3 mark is there. Anatomy is the study of structure of the human body. Physiology,
functions of the human body, and the next one is microbiology, study of microorganisms. So you can remember this things in a easy way that we can explain this one structure. Okay, suppose we are taking this pen. Okay, so this pen, how it is looking. Okay, so that is what, how our organ is looking, that structure we are going to study in the anatomy. Okay, so the next one is functions of the human body, that is what physiology, the organs, how it will be work. Okay, so the kidney, what is the working of the kidney, what is the working of the nephrons. Okay, so that is what we are going to study in the physiology. The next one is microorganism, study of microorganism, it known as microbiology. So in that you are going to study about the microbes, bacteria, morphological structure of the bacteria, then how it will be mutate. Okay, so all the factors like external features and all, you are going to study about the microorganism.
Okay. One comment is there, thank you ma, I will follow only this, can I pass? Sure, while following this video. Yes, if you are following this video means you will pass only for bioscience. Tomorrow or next day foundation revision is there, you should watch the foundation video also. But today if you are following this one, definitely you will get a pass mark, sure. Okay, but careful ആയിട്ട് listen ചെയ്യണം കേട്ടോ. You can speak in Kannada too, no?
Yeah. ಇದನ್ನ ಫಾಲೋ ಮಾಡೋದ್ರಿಂದ ಇದು ಒಂದು ಸಬ್ಜೆಕ್ಟ್ ಅಷ್ಟೇ. ನಾವು ಏನು ಇವತ್ತು ಡಿಸ್ಕಸ್ ಮಾಡ್ತಿದ್ದೀವಿ ಅದು ಬರೀ ಒಂದೇ ಒಂದು ಸಬ್ಜೆಕ್ಟ್ ಬಯೋಸೈನ್ಸ್, ಅನಾಟಮಿ, ಫಿಸಿಯಾಲಜಿ ಆ್ಯಂಡ್ ಮೈಕ್ರೋಬಯಾಲಜಿ ಇನ್ಕ್ಲೂಡ್ ಮಾಡಿ ಡಿಸ್ಕಸ್ ಮಾಡ್ತಿರೋದು. ನೀವು ಇದನ್ನು ಫಾಲೋ ಮಾಡೋದ್ರಿಂದ ಯು ವಿಲ್ ಡೆಫಿನೆಟ್ಲಿ ಗೆಟ್ ಎವ್ರಿಥಿಂಗ್ ದಟ್ ಹೌ ಟು ಸ್ಟಡಿ, ವಾಟ್ ಟು ಸ್ಟಡಿ ಆ್ಯಂಡ್ ವಾಟ್ ಆರ್ ದ ಇಂಪಾರ್ಟೆಂಟ್ ಕ್ವೆಶನ್ಸ್. ವೆರಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಪಾಯಿಂಟ್ ಆಫ್ ದಿಸ್ ಸೆಷನ್ಸ್. ಸೊ kindly go through the entire session, don't skip over anywhere. Your precious time, hardly 1.5 hour we used to conduct, 1.5 hour 2 hour max, so that will definitely bounce back you. Okay, yes, in the examination you will definitely, while seeing the question paper itself, you may feels that yes we heard about this, yes this is the question. Okay,
from the live only.
Yeah, from the live only, definitely.
I'm not sure about the classrooms, but from the live you will get. Okay, yeah. So okay, again we can start with the syllabus. The first one, anatomy, physiology, microbiology. In that different units are there. What are the units included in anatomy and physiology? Microbiology, some questions are there that are the predicted question that will be asked for your next examination. Only that question will be asked. Okay, don't worry, no too much about microbiology. Okay. Okay, so we can start with the anatomy. The first unit is about the introduction to anatomy. So introduction to anatomy, what is that? Introduction length we are discussing. What are the things
we are going to discuss about anatomical position. Very first we will go with the terminologies. Okay, so we have a certain different terminology. We can tell anatomy by knowing the meaning only. We can understand. We are going to study about the structure of the human body, organs. Okay, so same like that we have certain terms will be there, and in that we are going to study about the anatomical positions, and already I told terms related to the anatomical planes. Okay, the planes will be there, coronal or frontal plane, horizontal plane. Okay, so how our body we are going
and
to
also different terminology is there. Anterior,
superior,
anterior, posterior, inferior, superior, medial, lateral, proximal. From this, some of the one word question they will ask. What is anterior? Anterior means what is? Anterior means in front
of the body.
Front area it is known as anterior. Okay, anterior. And posterior means otherwise it is known as dorsal. It is known as back side. Okay, so if you are an anatomy student and after completing this exam or this live, definitely when you are talking to your friends also you should tell in my friend means in my anterior. Okay, don't use a friend. Because you are a medical student.
Yeah, if you have to tell using your this terminologies in every day, then only we can able to remember easily. Okay, so that is the thing.
Okay,
and next
that basic terminology we need to learn in the first unit. So from that we can expect only 1 mark question or itself. Like sometimes only they will ask a question like that. What is anterior? What is posterior? What is dorsal? What is flexion, extension, abduction? That much questions only they will ask. A clear explanation, one video regarding this one I done, and it was in the Nursing Bio official YouTube channel, so you can check with that. Okay, so that is enough. Otherwise again we are repeatedly it is explaining means it will lose your time. Okay, yeah. So same like next unit, and also next
introduction to the cell.
Okay, yes.
Structure of the body cell. Okay, so we know that eukaryotic, prokaryotic cell types and all in the previous sessions. 10th standard Gnm means they are basically come from science. They will study in the 10th standard. There we have studied, right? The same thing will carry over here, but it will be the broad spectrum of syllabus we can see over here. Okay, so that is the thing. So that is what.
So when and also other main units you have, that is about blood. Next is circulatory system. Circulatory system it is explaining about the heart and all. Next lymphatic system, you need to study about the lymphatic system, and the respiratory system. Another it is digestive system.
Unit 6 is respiratory system. In that we are mainly going to study about the lungs. Okay, what is the structure of the lung and function, like physiology which will comes, functions of the lung, that is very important. And the unit 7 we are going to know about the digestive system, how the stomach will be there. Yes, okay, so that is what we are going to study in this. And excretory system, excretory means in the sense we are going to study about
this year from the excretory system you won't get any essay question, because last year from excretory system essay question was there, so this year essay it is not there.
Long form,
but short notes they will get. Excretory system and the structure of kidney. Structure of kidney.
We are mainly going to study about the renal system in the excretory. That is very important.
Yes.
And
Ma'am, please, important questions we will tell. First, the basic, little bit explanation about what are the things we need to study. Okay. First, you should cover all those things. Then only we will discuss about the important question. So, how you can learn important questions? With the help of the syllabus only we can learn important question. Clear? So, important question. Before this important question discussion, it is the last session. So, first is the syllabus.
Okay. First we are going to study all the syllabus. What it is there, we can look into the particular units. Okay. Then after we can move to the important question session that will make sure you to get. Definitely we will give. Don't worry.
We will give.
That is why we are conducting.
That's the reason we are conducting
We are
this session.
conducting for that only. It will be very
and 30 above students are watching here. So just write something in the chat box, sir. We can discuss. Okay. Next is excretory system. We discussed that. Endocrine system. Next is about the endocrine system. Next.
Endocrine means we are going to study about the hormones. Okay. Endocrine system. We are going to study about the hormones in our body. Okay.
Yes.
And especially we are going to study about the pituitary gland, how the various types of hormones will be releasing, anterior pituitary, what is the work which is related to the particular hormone in through the anterior, and the posterior pituitary. Okay, now I am telling anterior posterior. If you study the first unit thoroughly, definitely you can able to understand.
Pituitary is one of the 5 mark question.
The next one is
reproductive
system. Here we are going to study about the both male and female reproductive system. Okay.
In both male and female reproductive system, just take male reproductive system, female reproductive system. Both these systems are divided into 3 types. What are they? First, internal organ, external organ, and secondary organ. Secondary organ only for the females. Secondary organ means that is breast. Okay. So internal organ are there, external organs are there. So classify that. Both female have internal organ, males have internal organ, females and males, they have external organs too. Same that type of classification you should follow. Then it is very easy to learn because reproductive system very easy and interesting. Next is nervous system. Nervous system, it is talking about the neurons. Neuron and nerve.
Yeah. The entire circulation, sympathetic nervous supply, parasympathetic nervous supply, what are the nerves will be there in our body. Okay, so it is one of the very important and very unique. You have to know how our brain will work. So that is very important.
Cerebrum is one of
cerebrum,
the
cerebellum, and the spinal cord also you are going to study in this particular unit. The next thing we are going to study about the sensory organs. Okay,
sense organs.
Yeah, that is what the sense
organs. Total how many sense organs? A lot of sense organs are there. Like ear, eye, nose. So actually tongue. For the GNS student this is important. But compare with the BSc student, BSc students they have less priority for the sense organ area. But for I cross-checked with a lot of your previous year question papers. For this live, we are cross-checked with your previous year question papers. So during the time, I noticed that the sense organ, especially ear, eye, it is very important. Again and again, repeatedly, they will get question. When I am studying also, I am not that much thorough with this sense organ. But now, in your paper, the sense organ have a great role to get 75 out of 75. Okay. So sense organ, you should
not skip that unit. Okay, you have to go with that unit.
Pasagam pasagum. Okay, next sense organ. Next
after that skeletal system. Okay, so while coming to the skeletal system, we come to understand that we are going to study about the bones. Okay, so majorly we are going to study about the bones, and we are going to study about the different types of bones, long bone, short bone, sesamoid bone. Okay, so we have certain different types of bones that we are going to majorly focusing on, and either you may get in the true or false region also will be you get meaning there is no chance. Short note.
Skeletal system. Skeletal system 5 mark questions will be good.
Yes ma'am.
5 mark question and not only 5 mark, some structure of the long bone was essay question.
skull bones, everywhere, everything you will get.
And especially when you are learning about the skeletal system, this clavicle it is important, sternum it is important, sternum it is important, scapula it is important, and the long bone also important. This much 4 bones you study, you will get.
Fibula, tibia, every bone.
Fibula, tibia, everything under long bone
only will
long
come.
bone
Okay. So everything is important. If you study thoroughly the classification of the bones, every bone will come
that
there.
That we will tell you now. Okay. Muscular system. This muscular system, I think it is very difficult to learn the terminologies.
Muscles name.
Because this terminologies and where the muscles are starting, this regions, the name, studying the name, it is very difficult. So how you need to study again and again, you should write and study. So then only this anatomy you can make it in your control. എന്തെങ്കിലുമൊക്കെ പഠിച്ചാൽ മതിയില്ല ജയിക്കുമെന്ന് പറഞ്ഞാൽ അങ്ങനെ ജയിക്കാൻ പറ്റത്തില്ല. നമ്മൾ എന്ത് ചെയ്യണം എന്ന് ചോദിച്ചാൽ അത് മനസ്സിലാക്കിയിട്ട് പഠിച്ചിട്ടുണ്ടെങ്കിൽ നമുക്ക് ജയിക്കാൻ പറ്റും. Okay.
How many times you will repeat it and recall? Okay, so that is the way if you are studying, definitely you are going to remember all the muscle name. Okay, see, if we have example that we are going to administer the IM injections to the gluteus medius muscle. Okay, so because we are everyday doing, that is why we are remembering like that only. You have to practice every day, definitely you will remember all the
now it's the exam time, so important things we will tell you, that things you should learn.
Follow.
Okay, otherwise just listen the class. Okay, now carefully listen, take a paper and a pen, share with your friends, your friends also will pass. So we can start. So first of all, about the basic anatomy. Okay, for everyone it is useful. Anatomy, Gnm BSc Postgraduate, whatever studying anatomy, it is useful not only for the nursing students, other students, like when BPD students are messaged, any type of help you are giving like that, like application or any classes we are conducting like that, they are messaged. So BPD students also is there, means you can also join with us. Clear? So introduction to anatomy, the basic terminology we are discussed.
Yes.
Next about the tissues.
Yes,
so when it comes to the tissues, listen, tissues and the kekom. In tissues, yes. A classification of tissues is important. Okay. Next. Classification of the tissues is very important. So why we are discussing again this one means from the examination hall you will get a 3-hour time. So 3-hour time you will get enough time to think what are the things I learned or hear during the live sessions and all. So you can write it possible. It is possible you can write. So when it comes to the tissues, you should remember the classification of the tissues. Okay, classification means the primary tissues are classified into 4. Okay, the tissues are classified into 4, that is epithelial tissues, connective tissues, muscles and nerve tissues. Epithelial, connective,
muscles and nervous tissue. So when it comes to the epithelial, what it will be happen is one of the primary tissue in our body. Okay, so the layers of the cell covering body surfaces and all the body curvatures,
cavities,
okay?
Body cavities, that is known as epithelial tissues. Okay, so epithelial tissues, what is the functions of epithelial tissue? That may be a 2-mark question. Functions of epithelial tissues, just I will tell the functions. Sound is very low. My sound is very low. Actually, up to yesterday, I have no sound also. I mean, voice rest. Funny aana, cold aana. Okay. Okay.
Sit in a silent place. Then you will listen.
Not like that. Just you will get some wind sound. Okay. Functions of the epithelium.
Functions of the epithelium, which will going to be know that form selective barriers, and we have to go with the protection from dehydration, chemical and mechanical damage, secretions, sensory functions like pain, touch, temperature, absorption. Okay, so these are the major functions you should know when it comes to the first classification, epithelium. Okay,
epithelial classification. First one, tissues classification, first is epithelial and the functions we are discussed. Okay, so again under epithelium epithelium. Again classification are there, that is simple epithelium. Next is pseudo-stratified columnar epithelium. Under the simple
epithelium,
again it is
divided
classified into
into
squamous, cuboidal, columnar. Okay.
So when it comes to the first one, epithelium, again this is, we know that epithelium is a covering of the external body surface or the internal surface. Okay, the next one we are going to study about the classification of the epithelium, that is what the simple epithelium. Okay, the first classification is simple epithelium. Again it is going to be divided into 3. Okay, the basic is squamous and the second one is cuboidal and the third one is columnar. For squamous we can give an example like alveoli of the lungs, and for cuboidal we have the example like collecting tubule of the kidney. Okay, there we can see the epithelial tissues. Okay, squamous epithelial and the cuboidal epithelial. The third one is columnar.
Yes. And when we will get like an essay question, sometimes essay, epithelium also essay question. Yeah. So you should draw the diagram. So bioscience, anatomy, physiology, it is very important. You should draw the diagram. So usually the epithelial, columnar epithelium, it is like that. Okay, different types of epitheliums are there. Then squamous epithelium, it is like that. Okay, so that is a speciality of anatomy, anatomy and physiology,
each and everything you have to go with the structure and their function
diagram.
Should be focused more in this particular
function, and as well as when if they get any question means if there is any chance to draw the diagram means they should draw the diagram.
See, in your paper only they will mention wherever the necessary the appropriate diagram should be drawn. Okay, from the your board only they will mention in your question paper. So for
draw the diagram that, okay? Wherever necessary.
And that also should not write in the pencil. Use a pen. Okay, this is my reminder.
Yes.
Use a black ball pen. I have seen so many students that they are using the pencil. So pencil.
So don't use pencil. Use pen. Okay. So if you are drawing a picture, use pencils because it is scanning is the paper scanning. Okay, when paper it is scanned, if you are using pencil it is not that much visible. So that's the reason everyone is talking you should draw with a pen. Okay, so that is the reason everywhere for underline.
There is nothing
also
that you will never get a what prize for drawing. So ma'am have written no, easily we can understand, simple way.
Simple diagram it is needed. Okay. And sometimes one time when valuation time I saw that they are darkening, giving shading.
Shading.
So if you are giving shade for any diagram means actually the diagram it is nice, but your time will be
go lost.
Your time will be reduced. So that's the reason it is not necessary simply draw a diagram.
You
so
can
what
look here only.
What the evaluator they will assess you how much you are aware about the anatomy, what about the structure, and what are the knowledge you have, that only they will assess. Okay.
See, if we can go with this kind of diagram, okay, suppose if drawing, the person expert will going to be draw very nicely. Okay, I am not very good at drawing. I can write in a very simple way. Okay, so but it shows that it is a stomach. Okay, we can by seeing only. That is important. That point you get it. And
so
write.
Don't be concerned with your drawing capacity and all.
Yeah.
Don't worry about that. Okay. So special connective tissue. Hi everyone. So for if you are watching through the Instagram, you just come to YouTube. So in the YouTube we are conducting live. It will take you more than 1 hour. So completely everything. So predicted question for the GNM students. As per your request only we are conducting the GNM live classes.
Yes.
So that's the reason which language, Kannada, English, Malayalam, you can message us. We will communicate through here. So you can come to YouTube and message to us. Definitely we are here for help you. Now the 1.5 hour is there. So definitely bioscience is the first examination. What are the concerns you have, you can address. We will address what you without any hesitation address here. Okay. So next about the connective tissues. Connective tissue, what are they? Cartilage, bone and
hemopoietic tissue, blood and the lymph.
These are the connective tissues. Okay. So I'm not explaining more about that because in the next session it again repeatedly it comes. Next about the nerve tissues. Okay, structure of the neuron. I will draw one structure of the neuron.
Yes.
So structure of the neuron also a 2-mark question. 2-mark question. like that.
Yes.
So you just tell me which part it is. Okay. Structure of the neuron. Structure of the neuron. When any question you will get like a neuron, definitely draw the structure. Okay, it is a simple structure. Listen this one. And here one myelin sheath.
Axon.
No, this one is myelin sheath. Okay, so this is a structure of neuron. Okay, structure of the neuron, it is very important. So I will tell which portion it is. What is the name of this area? Anyone have any idea? Means just comment here. First it is starting with the dendrite. Okay, dendrite. Then next this is the nerve cell. Nerve cell. And the next area it is about the axon. Where it is? Where the axon? This is the axon. I'll use different color. Okay, this is the axon. Okay. Axon. Okay, now itself you should learn to draw the diagram of
Neuron.
Okay, this is the terminal nodules.
Not
Buttons. This is a simple structure of neuron. Simple structure of the neuron. Elaborated structures are there. Different textbooks. Maybe you are referring. I am referring. Ashala the textbook. Rosen Wilson textbook is there. It is little bit complicated and easy. Vijay publication textbook are there. That is very easy. Maybe you are following that one. From there also you can see different structure of the neuron. Draw the structure of the neuron when you will get a question like that. Okay. And also when you are learning about the structure of the neuron, again neuroglia is one of the area. Neuroglia. What is neuroglia? Neuroglia is the supporting cells that are present within the brain and the spinal cord. That is known as neuroglia. Clear? So that is neuron and a neuroglia. Clear? Okay. So muscle. When it comes to muscle tissues. Muscle tissues, the classification, 3 classification is there. What are the 3 classification of the muscle? First is skeletal. Is it? Skeletal. Next, cardiac. Third is smooth. In one class we are discussed about that. Anyone remembering? Means just a message. Okay. I'm just checking any of the command is there. Exam postpone chahiye. Exam, there is no chance for postponing exam.
Still now we don't
Still
get
now,
any
no information regarding that.
updates.
If any chance for exam postpone means already there may be published any notification. I think there is no chance.
There is no chance to
Okay.
postpone.
So this 23rd your exam. 29 means your exam. Like that you studied. Okay. Okay, so next about the classification of the muscle. 3 classification are there: cardiac, smooth and skeletal muscles. Skeletal muscle, what are the difference between skeletal muscle, cardiac muscle and smooth muscle? Just you can draw the images also. Cardiac, first one, skeletal muscle. Skeletal muscles where it is present. It is present in the limbs of the body wall because of it is close relationship with the bony skeleton. Same like the word പറയുന്ന പോലെ തന്നെയാണ് skeletal muscle എന്ന് പറഞ്ഞാൽ bony regionsലായിരിക്കും skeletal muscles ഉണ്ടാവുക. Okay, skeletal muscles. Okay, so main functions of the skeletal muscle is contraction, elasticity and maintenance of the posture. What are the functions? Contraction, elasticity and maintenance of the posture. Next about the cardiac muscles. Cardiac muscles എവിടെയാണ് ഉണ്ടാവുക? Cardiac muscles, the പേര് പറയുന്ന പോലെ cardiac muscles ഉണ്ടാവുക cardiac regionലായിരിക്കും അല്ലേ? It present exclusively in the heart and in the beginning of the large vessels arising from it. So heartil കാണുന്ന muscle that is known as cardiac muscles. So what may be the function? What is the special features of this cardiac muscle? Cardiac muscle fibers are supplied by autonomic nervous system. ANS, autonomic nervous system is supplied by cardiac muscles. Next about the smooth muscle. This is the structure of a smooth muscle. It is very easy to draw the structure of a smooth muscle. Smooth muscles is present in the relation to the walls of the hollow visceral like stomach, intestine, ഇത് ഹോളോ ഓർഗൻസ് ഉണ്ടല്ലോ, ഓപ്പൺ ആയിട്ട് അതിൻ്റെ ഉള്ളിൽ കൂടെ സ്പേസ് ഉള്ള ഓർഗൻസ്, ആ ഓർഗൻസിൻ്റെ പരിസരത്തോടെയൊക്കെ കാണുന്ന മസിൽസ് ആണ് സ്മൂത്ത് മസിൽസ്. ക്ലിയർ? മൈ വോയിസ് ക്ലിയർ ആണെങ്കിലും പറയണം, എന്തെങ്കിലും ഡിസ്റ്റർബൻസസ് ഉണ്ടെങ്കിലും പറയണം കേട്ടോ. ഓക്കെ, സോ ദാറ്റ് ഈസ് അബൌട്ട് ദ കാർഡിയാക് മസിൽസ്, സ്കെലറ്റൽ മസിൽസ് ആൻഡ് സ്മൂത്ത് മസിൽസ്. ദെൻ നെക്സ്റ്റ് അബൌട്ട് ദ ലിംഫാറ്റിക് ടിഷ്യൂസ്, lymphatic tissues that are important. Classification of the lymphoid tissues are also found in the various sites, spleen, thymus and tonsils. Regarding lymphoid tissues, what is the function of lymphatic? Okay, you can explain.
Yes, ma'am. So we are having spleen, thymus and the tonsils. Okay, so when it comes to the lymph nodes, okay, here we are going to study about the, like it is a bean shaped, it's a concave surface called the helium. So it is having like, it's a bean shaped structure we are seeing usually present in the group along with the course of lymphatic vessels. Okay, it is always like the blood which where the capillaries will be there, no, the fluid will be content passes through the surrounding tissue. So there we can see the lymphoids. Okay, then when it comes to the lymphatic, from different parts of the body ultimately end large vessels like a thoracic duct. Okay, we can see the duct like structure, that is what we are going to study, the lymphatic system. Okay, so there the lymphatic tissue or the lymphoid tissue we can see like a spleen, thymus and the tonsils.
Which question we can expect? A spleen.
Yeah.
Only the structure
regarding
of
the
spleen
structure of
may be
spleen
asked.
and the functions of the tonsils. Okay.
And also thymus. Sometimes thymus it is important. Okay, so thymus and spleen, it's an important area from the lymphatic system. Okay, next about
next
the
we can go with the skin and its appendages. Okay, so when it comes to the skin, it is one of the very huge,
very big chapter.
big organ, and as well as
means about the skin means the functions of the skin may be one question. Functions of the skin. What are the functions?
and fill in the blanks also they can ask, which is the largest organ in our body.
Yes,
The
that
skin
is one
is the
common.
largest organ in the body. Okay, so there may be a chance for that also. The next one, function. So functions also is one of the skin provides a mechanical protection to the underlying tissue. It will be acts as a physical barrier.
It
Okay.
will act as a physical barrier. Especially the main function of the skin is protection.
Yeah. Whatever the outer things or the microorganism wants to affect our body, skin will be the first and foremost organ to fight against that one. It will be always provide a protection to fight against that any disease condition.
And
or
also
anything.
it prevents the water loss from our
the
body. Water loss from our body, and also it is one of the important sensory organ. Okay, when we can feel touch and everything. Okay, so when we are talking or remembering about the skin, you should remember about the hair,
appendages,
nail and sweat glands and
sebaceous glands. Okay, so usually the sebaceous gland which will be more producing the sweat and all. Okay, so that is the thing we are going to study.
One question is there, can you share the notes? Definitely I will show you what is the note. This is the textbooks. Okay, so only we have the textbooks. With this textbooks only we are discussing. For the easy and concise note, if you need, you just download and use Nursing Guru app.
Application.
Okay, otherwise use different textbook. Lot of textbooks are there for anatomy. This is Ashala, the textbook. Different. Lot of textbooks are there.
Rosen Wilson will be there, and you can various textbook according to your priority of study you can use.
Okay. Okay, that is about the skin. Then
Skin and their appendages.
Next main portion, that is
musculoskeletal
system. Okay, so when it comes to the musculoskeletal system, what are the things we need to study? First is osteology. What is osteology? That is about the study of bones. It is known as osteology. So functions of the bone may be a two mark questions. Functions of the bone. Why bone is important? Bone is important because it is provide a framework to the body. First, it provide a framework to the body. Okay, next, it gives support and transmit the weight of the body. It gives support and transmit the weight of the body. Okay, storage of calcium. Bones മോസ്റ്റ്ലി കാൽസ്യം ഉള്ളത്. അപ്പോൾ സ്റ്റോറേജ് ഓഫ് ദ കാൽസ്യം എവിടെയാണ്? ബോണിലാണ്. സോ ദിസ് ഈസ് വൺ ഓഫ് ദ ഫങ്ഷൻ. ആൻഡ് ദ നെക്സ്റ്റ് ഫങ്ഷൻ ഈസ് ഫോർമേഷൻ ഓഫ് ദ ബ്ലഡ്. ഇപ്പം ഞാൻ 4 കാര്യങ്ങൾ പറഞ്ഞു. ഈ 4 കാര്യങ്ങൾ ക്ലാസ്സിൽ കേട്ടത് വെച്ച് നിങ്ങൾ എഴുതിയാൽ നിങ്ങൾക്ക് 2 മാർക്ക് കിട്ടും. അതുകൊണ്ടാണ് റിപ്പീറ്റഡ് ആയിട്ട് I used to tell about what is the functions of the blood. So when it comes to the skeletal system basically it is divided into 2, that is appendicular skeletal system and the axial skeletal system. Okay. So in that appendicular complete explanation it won't be useful for them. So we can do one thing, which are the important things that only we will explain. Yeah. So first thing, clavicle. Clavicle, for BSc student, clavicle is a 5-mark question. But for the GNS student, in the past year, recent 5-year question paper I checked, in that I haven't seen any question like a clavicle. But clavicle, draw the structure of the clavicle. It is no. This year in 2025 December 29, in that question paper, it is not there. Clavicle.
It is there.
It is not there.
Not there.
Sure. But clavicle you should
have
learn.
to know.
Where is this clavicle? Clavicle is otherwise known as beauty bone. This is clavicle. Yeah, this
Here
bone. Everyone, how many are there? Please touch your clavicle. So clavicle, this bone, it is known as clavicle. And clavicle and their structure, simple structure, clavicle. I will draw that. Like a clavicle. Like this clavicle. Only 3 areas are there. Lateral end, shaft.
Medial end.
Lateral end. Shaft.
And medial end.
And medial end. Okay. So this is the structure of clavicle. Just to remember this one. Okay, that is enough. Next, again, dear students, if you are seeing, means share with your friends. Definitely we need more people. Okay, next about the scapula. Scapula, which portion? The scapula means this area. Yes. So this bone, it is known as scapula. So scapula, or otherwise it is known as shoulder blade. Scapula or shoulder blade. Or this bone, it is known as scapula. Just if you got what is scapula means, they can elaborate. They can write in their own words. Is it? So next about the long bone. Explanation of any of the long bone also it is important, I think.
See, while writing the anatomy, you should like focus on what is this, and you have to first write, then after location, shape. Okay, so that is how you are going to elaborate your answer.
Yes, one structure of the anatomical neck, the shaft. This one long bone, it is important, and you should learn the structure.
See, the classification you learn, and in that give example for each and every classification. That is enough. And if they are asking individual bone means long bone, and we are having the clavicle and all will be there, and the sternum there may be a chance to get. So that is also one of the very important.
And now I remember about when the long bone, I was remembering greater trochanter. Repeatedly we are learning about the different portions. Okay, so that is about the osteology. Next about the skull. Skull also, it's an important portion. Don't forget to skip. So these many things is important from the osteology or the which one?
Regarding the
bones.
musculoskeletal.
That is enough. Next about the muscles. In that muscles you should study about
630 muscles in our body. Each and every muscle, now it is difficulty to remember. But you should learn the deltoid muscle. What is deltoid muscles? Deltoid muscles and how it is located. And you also try to draw a diagram. When next is joints. Okay, joints is an essay question. Joint is an essay question. Define joints and functions of joint. Explain synovial joint or that bone and socket joint. That is one question. You can expect this year question paper. Okay, joints. What is joint? Joint is formed with 2 or more bones come together. This come together ne nammal anatomically parayunnaanu articulate. Okay, articulate together. That is known as joints. Okay, so fusing of one or more bones. Okay, that is what joints. So we have important portion is that synovial joint. Okay, so in that synovial joints we have a joint cavity.
Synovial joint, when you are drawing the synovial joint, it's drawing like that. This is synovial joint. Features of articular cartilage. Okay, just to remember about the synovial joint, that is
Usually
important.
we are seeing in the body midline this synovial joint in the pubis area, and we have next system, very important.
Okay, then again that the rough and tough areas already it is over. Now it's a time to go with the interesting areas. The first interesting area, that is our circulatory system. So circulatory system means what are the main important organ included in the circulatory system? What are they? Circulatory system that include one hollow muscular organ that is situated in the middle mediastinum in the thorax. So what is that? What is the name of that organ? That organ name, it is known as heart. Okay, the structure of the heart, it is important. Simply, sometimes you will get this time essay question, structure of the heart, and structure of the heart, and sub question it how it is come, structure of the heart
and cardiac cycle. They
cardiac cycle. They may be asked. For Gnm cardiac cycle, they won't ask. But explanation, structure and labeling, they may be asked. What is circulatory system? Part of circulatory system, and draw a neat label diagram of heart. Okay?
Yes,
10 mark.
10 mark question, they may ask heart.
So when you are talking about the heart, this word is very important. Heart, it is a hollow muscular organ. Tell again, repeat. Heart is a
hollow muscular organ
which is situated in the middle mediastinum of the thorax. Which is situated in the middle mediastinum of the thorax. Okay, it plays in between two lungs. Okay, രണ്ട് ലങ്സിന്റെ നടുവിലായിട്ടാണ് above the diaphragm. The location exactly above the diaphragm and in between the lungs. Okay, so remember
behind the sternum it is going to be located, and it is one of the very vital organ in our body. And
normally the weight, what about the weight?
It is comparatively, for males it is around 300 grams, and for females it is around 250 grams. Okay. So
and also slightly on the right side, we know that the diagram we can explain. Okay, so before that, any information, this one, the heart is the right side of the heart.
The heart receives a deoxygenated blood, and see, before going to that, we have to know about this chambers. Okay, the 4 chambers and 2 atria, 2 ventricle will be there in our body, heart. And in that also, the heart is slightly larger than a clenched fist. Okay, so most probably it is in this size only.
Yes, this is a structure of a heart. Okay, you can see in here structure of the heart. Clear? Okay, so what is this area? Labeling, it is important. So if you are labeling like at least 4, they will get a mark.
Yeah.
Okay,
you have
simply I will tell that here 4 opening, 4 area, hollow areas are there. Which are the 4 areas?
2 ventricle.
How it is? I will draw. This area, it is known as aorta. And this is arch of aorta. Okay, this is arch of aorta. Okay, I'm just dividing this area and this area like this. This is this 4 portion you should cover. Okay, this is a basic structure of a heart. Okay, so you can learn this one also. Okay, first this is right atrium. This is right atrium. So this is the right side. So right atrium. This is right ventricle. Clear?
Yes,
right
we know
ventricle.
that, no? The heart, we are having 4 chambers. First it is divided into 2 atrium, 2 ventricle according to the sides. Okay, so right and left. Right
So
atrium.
this is right atrium, this is left atrium, this is right ventricle and this is left ventricle. So for labeling it is okay, clear. Is it?
Okay, this much at
Next this area, this one. Okay, this one it is known as superior vena cava. Superior vena cava. This is the region. Okay.
Because it is in upside. Okay,
Yes.
hint. You can remember easily.
This is superior vena cava. I hope it is clear. This 3D diagram help you to understand very easily. Okay, so another fifth one. Fifth labeling, superior vena cava. So here in the down area, it is usually, what is the name? That is inferior vena cava.
Inferior vena cava.
Inferior vena cava, superior vena cava and inferior vena cava. That you can see in here. And also this arch. What is the name of this area? That is aorta. This arch, here one arch is there. So you get arch of aorta or aortic arch. Arch of aorta. This is arch of aorta. Kittiyo?
So this is very easy to understand and you can remember for so long.
This is pulmonary trunk. Next, tricuspid valve and bicuspid valve. Where this tricuspid valve? Tri means 3. So here you can see the valve. Clear? Okay, I hope it is clear. And simply in this end of the heart, this area it is known as apex. Okay, I hope it is clear. Structure and labeling of the heart you should
learn. Okay, so this is how it will be there, and systemic circulation is also one of the important topic in this particular topic. So you have to go with that.
Yes, heart also you have to draw with a pen only. Anything, any diagram means you should draw with a pen. Heart in the structure ചോദിച്ചാൽ ഈ സ്ട്രക്ചർ വരച്ചേക്കണം, കുറച്ചും കൂടെ വൃത്തിയിലൊക്കെ വരച്ചോ, അതിൽ കുഴപ്പമൊന്നുമില്ല, മോശമാക്കാണ്ടിരുന്നാൽ മതി. So use pen. Okay, then pulmonary circulation and systemic circulation they may be asked. Okay, then anything you need to regarding this heart or circulatory system, sometimes you have some clarification, some areas you need some clarification. If you need any clarification in any area like circle of Willi, like circle means pulmonary circulation, anything means you just write here, I will clarify that. Otherwise I think you are very familiar with this cardiovascular system.
And don't forget to write about the blood
supply, arterial supply, and when it comes to the arterial supply, heart gets the oxygen and nutrient from the two different arteries. The artery, it is known as the right and left coronary arteries, and which are the first branches of the aorta. Okay, that is about the arterial supply. Okay, then venous drainage, coronary sinus. Hope it is clear. Any additional information needed means just a message, because we don't know how much you are learned like that. Clear? Then arch of aorta, sometimes it is known as 2-mark question. Okay, arch of aorta.
They may ask us aortic arch also.
Yes. Then descending aorta, everything that is important. Cardiovascular system, vein circulation.
In circulation system, each and everything which will be heart. Okay, so from the heart till the veins, each and everything is important. Go through that. Okay, and madam already shown a very simple and minimalistic diagram.
Simple diagram, and
you can easily
you just draw the diagram, and labeling it is important. Okay, so labeling also important. Okay, we can move with the next system, that is about the respiratory, and I will show you the blood circulation of the human heart. See here. Here again you will get this is our heart. Okay. Hope you can see here the right atrium, and right atrium it is receiving the deoxygenated blood, and from the left atrium oxygenated blood. Here superior vena cava, pulmonary artery, aorta, left atrium, right atrium. You can see that how the blue color, this blue color balls indicated the oxygenated blood, and red color, blue color it is oxygenated and it is deoxygenated and red color
is
oxygenated. Okay. Yes. Then next about the lungs.
So the next one is respiratory system. So it is including in the exchange of gases, and we are going to study about the nose and the nasal cavity and pharynx, larynx, each and everything which is related to the lung
it is starting
structure
from
of
the nose. Respiratory
The
system starting from the nose. Then it comes to the pharynx. Then go to the larynx. Larynx, here one area is there, na? Larynx. Then trachea. Then it's branches, bronchi,
and it will go into the bronchioles, and the last is alveoli of the lungs. Okay, these are the functional
that
key
are the
bodies
air
of the
passage, a flow chart of the air passage of the respiratory system. Cardiac cycle is important or not? Cardiac cycle, it is important.
But
for GNM student, cardiac cycle, it won't come.
Yes, ma'am.
50% chance if it is came
means you have to know about that. Most probably they will not ask that much
very deep questions they won't ask. Okay, next about the heart, lungs. Okay, lungs, it is starting from
nose.
Yes,
It is
nose
starting from the nose and the pharynx.
Then it comes to
the
trachea.
larynx.
Larynx. Larynx, it is here only. Then it's the trachea. Then this trachea, it is divided into two
lungs.
That is known as bronchi. This is just a structure of lung. Okay. Okay. Then these are the two lungs, left and right lungs are there. Then this is again divided into
two lobes.
Two different lobes.
Upper lobe and the lower lobes.
Yes. Upper lobe and
lower lobes.
This notch, it is known as cardiac notch.
And this one is the middle lobe.
That is the middle lobe. Upper lobe, middle lobe and the lower lobe. So basically this is the right lung, left lung. Okay, structure of the lungs. So draw the label diagram of structure of the lungs means you can draw like this: left lung, right lung and left lung. The right lung, the lobe is divided into three. So you can see the three different marks. So that is divided into three: upper lobe and middle lobe, lower lobe. This is known as a fissure. What fissure? Horizontal fissure. That the area which is converting upper lobe and middle lobe, that area it is known as horizontal fissure. Then everything you should remember that here we can see this end portion, it is known as apex. Same like in this two area it is known as apex. Okay. For the labeling it is good and useful. So that's the reason we are explaining. Okay. So this is the lower lobe, this is the cardiac notch. So this area for the heart. Clear? Cardiac notch. So this is the structure of a lungs.
Okay. So this is also one of the important question.
And pleura.
Pleura. Okay, so this is the pleural cavity.
What is pleura? That is one word question. Pleura. Pleura means
a serous membrane, serous membrane lined in a single layer of squamous cells. The mesothelium are the two pleural sacs, one of either side of the mediastinum. Okay, so these are the single lined membrane. Okay, so pleura are the single lined membrane of the squamous cells. Okay, so where we are going to see this pleura? We are telling lung. Where is it? It is located
The
pleural
cavity.
cavity. Okay, so the pleura. That
Simply
one.
pleura means it's the covering of the lung.
lung.
It is known as pleura. It's a one word question. What is pleura? Okay, then next is about the digestive system. Okay, digestive system, part of digestive system, it is one question. As a part of essay question, you will get a question like that. Explain the part of, not explain, list the part of digestive system and explain stomach in detail. So, it is starting from our mouth. Clear? So, it is starting from the mouth and it comes to when we are having food, how it is work. We are having food, food is entering into the mouth. Then it's go to the pharynx. So, pharynx again it is classified into three: nasopharynx, oropharynx and laryngopharynx. Then through this pharynx, food is entered into the esophagus. So, it comes to the esophagus. Through the esophagus, the food is entered into the stomach. Okay, from the stomach onwards, different actions are there. Food is dividing, converting into different forms. That is in the physiology area. You are learning about that. So the food currently where it is in the stomach. From the stomach, it is moved to the duodenum, means the small intestine. Duodenum. From the duodenum, it moves to the jejunum. Jejunum is one of the part of the small intestine. Again, from the jejunum, from where it is going? It is going to the ileum. Okay, clear. So it comes to the ileum. Then it moves to the colon. Means the large colon. Okay. Okay, so that is known as ascending colon. The colon it is divided into three: ascending colon, transverse colon and descending colon, and it is enter into the rectum as like a waste product. If the food comes to the rectum through the anal canal, it goes outside. Okay, so that is the basic digestion. So clear? When you will get a question like that, explain the or list the parts of digestive system. You should explain. No need of explanation, just mention.
See, one small diagram will come. Okay, so all the digestive system in a one particular diagram which will come. If you can able to draw that, it is very essential.
And in the digestive system, teeth also one area. Teeth maybe they will ask, and also tongue. Then it's the main area. It is stomach. Okay, so stomach, what is stomach? Stomach is the most dilated part of the human body.
It is also one of the halomuscular area filled with the, which one? Which
Food.
acid will be there?
Which acid it is there?
HCl will be there, and it is having like, we have a three parts.
Lungs,
it is a J-shaped
respiratory
organ.
system, lungs is important. Okay, so then where it is the position? In the supine position, stomach occupies the part of epigastric, umbilical and the left hypochondrial region. Okay, what is the shape of the heart?
Sorry,
J shape. Okay, shape of, sorry, not heart, that is stomach. What is the shape of the stomach? It is a J-shaped organ. It is a J-shaped organ. Then the stomach. What are the important things?
See, here we are going to see like a very important point: esophagus, body, fundus and pylorus, duodenum, cardiac sphincter. Okay, so here we can see the pylorus not.
And also this area, it is known as greater curvature and this is lesser curvature.
Here we can see the cardiac notch. And we can see here the pyloric part. Okay, so these
how
are
to draw the diagram? You can see the diagram here. You can draw the diagram like this.
Yes.
Yes. This is stomach. Okay, J-shaped. Yeah, this is the esophageal region and this is the duodenal region.
Okay.
Okay. So in this method you can draw the, and if you have any book and pen means just to write if it is possible. Just to draw that one. And okay, that is about the stomach.
Blood
stomach
supply,
is
blood supply also it is very important here. Arterial supply from the celiac trunk we are getting, and we are having hepatic artery. Okay, hepatic artery, that's blood supply. You can study by yourself and go through that. And again, duodenum is important. Pancreas is important. And
yes.
We have all colon also. Colon is also one of the important
colon
sector.
also, but mostly the colon for the BSc.
See, They are not supposed to asking deep.
But in the digestive system, another one area is there, that is the accessory organs of the digestion. It is known as liver. So liver is the important area. Liver, you will get like an essay question. Liver is the largest gland in the human body. Liver. Like one word question also you will get like that.
And
liver, this is the largest gland in the body. And what is the color of the liver? It is the reddish brown in color and highly vascular, and it weight around 1.5 kilo in adult. 1.5 kilo കാണും. അഡൾട്ടിൽ ഒരു ലിവറിൻ്റെ വെയിറ്റ് വരുന്ന 1.5 kilo ആണ് കേട്ടോ. Okay, so liver, basically the structure of the liver, and when it comes to the structure of the liver, it is more not that much of explanation, it is not possible about the parts of liver, but right lobe, left lobe, you need to remember where is the right lobe and the left lobe, and in the downside one small area it is there, that is for the gallbladder, that is for the gallbladder. Okay, tongue twisting.
Yes, ma'am. Gallbladder is also there.
Okay, so you are watching, it is clear means you just write it in the light session, because we both have fever, so our
voice
sound
is not coming properly, even though we are giving
classes.
because
So if you are giving messages, that is clear, everything like that messages if you are giving means again we will take more classes. Okay, then what is the functions of the liver? That is a question.
Yeah, functions of the liver is
first
that
function.
Secretion of the bile is the important type of functions in this particular organ, and we are going with the storage of the glycogen. Okay, each and every process which will be taken place in the liver only. Okay.
Yes. Next function is gluconeogenesis.
Okay.
Gluconeogenesis. Remember what is gluconeogenesis?
Then next one is
metabolism of the fat. Fat metabolism.
Fat metabolism which will be taken place in the liver only. Okay. The next one is dimension of the amino acids and the production of ammonia.
Production of ammonia. Remember, simply production of ammonia. Okay. Next, metabolism of the fat. Glyconeogenesis.
Production of the plasma proteins.
Okay. Next, storage of the vitamins. Vitamin or vitamin, anything. So
vitamins and as well as the minerals also going to storage here only.
Then storage of the iron.
Yeah.
Storage of the iron. Then clotting factors means some of the clotting factors are produced from the liver. That are clotting factor 5, 6, 7. Clotting factor 7 will be produced from there. Then detoxification. Liver detoxify ചെയ്യുന്നല്ലേ ആൽക്കഹോൾ ഒക്കെ കൺസ്യൂം ചെയ്യുന്ന ആൾക്കാർ പറയുന്നത് detoxify എൻ്റെ ലിവറിനുള്ള detoxify ചെയ്യാൻ വേണ്ടിയിട്ട്. So the main function is
it is going to be remove the toxic substances from our body.
Especially medicines ഒക്കെ കഴിക്കുമ്പോൾ അതിൻ്റെ ഡീടോക്സിഫിക്കേഷൻ നടക്കണമെങ്കിൽ എക്സ്ക്രീഷൻ നടക്കുന്നത് യൂഷ്വലി ത്രൂ ദ ലിവറിലൂടെ ആയിരിക്കും. യെസ്, ദാറ്റ് ഈസ് ദ ഫങ്ഷൻ ഓഫ് ദ ലിവർ. ഇത് നിങ്ങൾക്ക് നെക്സ്റ്റ് എക്സാമിന് വരും. ശ്രദ്ധിച്ചിട്ടില്ലെങ്കിൽ അത് എഴുതാൻ പറ്റൂല, ശ്രദ്ധിച്ചിട്ടുള്ളവർക്ക് മാത്രമേ എഴുതാൻ പറ്റുള്ളൂ. സോ മനസ്സിലായിട്ടുണ്ടെങ്കിൽ പറയാം കേട്ടോ. നെക്സ്റ്റ് ഈസ് യൂറിനറി സിസ്റ്റം. യൂറിനറി സിസ്റ്റം, യെസ്. Urinary system, it is important, means two kidney and the full the urinary system. So urinary system and the part of urinary system, it is important. And the components, what are the part of urinary system? Urinary system, we have kidney. How many kidney you have? Where is your kidney? How many kidney you have? Okay, so kidney means we have 2 kidneys. 2 kidneys are there. 2 ureters are there, 1 urinary bladder and a urethra. So these are the part of excretory system or components of urinary system. Urinary system and excretory system same ആണ് കേട്ടോ. ഓക്കെ, സോ ഹിയർ നമുക്കറിയാം 2 കിഡ്നി ഉണ്ട്. സോ കിഡ്നിയുടെ സ്ട്രക്ചർ, അതിൻ്റെ എക്സ്പ്ലനേഷൻസ് ഒക്കെ ഇമ്പോർട്ടൻ്റ് ആയിരിക്കും. സോ കിഡ്നീസ് ആർ എ പെയർ ഓഫ് എക്സ്ക്രീറ്ററി ഓർഗൻ സിറ്റുവേറ്റഡ്. വെയർ ഇറ്റ് ഈസ് സിറ്റുവേറ്റഡ്? അനാട്ടമിയിൽ വെയർ ദ പൊസിഷൻ, അനാട്ടമിക്കൽ പൊസിഷൻ എക്സ്പ്ലെയിൻ ചെയ്യാൻ നിങ്ങൾക്ക് എക്സ്ട്രാ മാർക്ക് കിട്ടും. സോ അനാട്ടമിക്കൽ പൊസിഷൻ എക്സ്പ്ലെയിൻ ചെയ്യാൻ പറ്റുമെങ്കിൽ എക്സ്പ്ലെയിൻ ചെയ്യണം, ബിക്കോസ് ഇറ്റ് വിൽ ഗെറ്റ് ലോഡ് ഓഫ് മാർക്സ്. ദെൻ സിറ്റുവേറ്റഡ് ഓൺ ദ പോസ്റ്റീരിയർ abdominal wall, one on each side of the lumbar part of the vertebral column. Okay, so ഇതിൽ ലെഫ്റ്റ് കിഡ്നി സ്ലൈറ്റ്ലി ഹയർ ലെവൽ ദാൻ ദ റൈറ്റ് കിഡ്നി. അത് നിങ്ങൾ ജനറൽ നോളജ് ആയിട്ട് എടുക്കുക. ലെഫ്റ്റ് കിഡ്നി ഇറ്റ് ഈസ് സ്ലൈറ്റ്ലി ഹയർ ലെവൽ ദാൻ ദ റൈറ്റ് കിഡ്നി. വാട്ട് അബൌട്ട് ദ സൈസ് ആൻഡ് ഷേപ്പ്? കിഡ്നിയുടെ സൈസ് ആൻഡ് ഷേപ്പ്. Urinary system means just basic urinary system like that. 2 kidneys are there.
You're right.
Okay, urinary system. Kidney and ureter. Bladder, left kidney, right kidney, ureter. Clear? And the last time in the last examination, nephron was one question, sub question. Means kidney and explain about the nephron. Nephron function and the nephron.
It is the functional unit of the kidney which is we are using in the infiltration. Okay, so there we are using this the nephron function will be taken place that you have observed. This only, no, ma'am. Yeah.
The
Infiltration
the
process
part
which will
of
be taken place.
nephron that is PCT means the proximal convoluted tubule, then the loop Henle and the distal convoluted tubule. Adonu remember cheyidu vachekane. Okay.
So this is the things which will be taken place. Infiltration is the thing which will be taken place from the nephron only. And see, here we have like a relation, the function. We have certain parts of this nephron. There we are going to study like glomerular capsule will be there, proximal convoluted tubule, loop Henle, that ma'am told, right? So the same things which we have to mention in the nephron diagrams. See, here we are mentioning, no, don't write like that. Inside one more diagram will be there, that you write and write. And filtration of the molecules and water from the blood, and selective reabsorption of many substances which will be taken place like glucose, amino acid, plasma proteins, everything. The filtration which will be taken place here and creates the hepatic environment for the medulla and facilitate water reabsorption will be taken place here, and the selective reabsorption of the ions also which will be taken place in the nephrons.
Okay, so that is about the excretory system and urinary system. Next about the reproductive system. Okay, reproductive system. Reproductive system is നമുക്ക് ചോദിക്കുന്നത് യൂട്രസ് ആയിരിക്കും അല്ലേ? യൂട്രസ് മേ ബി വൺ ഓഫ് ദ ഇമ്പോർട്ടൻറ്റ് ഏരിയ. സോ ഇൻ ദ ഫീമെയിൽ ജനൈറ്റൽ ഓർഗൻസ്, ഫസ്റ്റ് ഫീമെയിൽ ഓർഗൻസ്, നെക്സ്റ്റ് മെയിൽ ഓർഗൻ, next secondary organ. So female organ it is classified into external organ and internal organ and secondary organ. External organ that include the mons pubis, labia majora, labia minora, clitoris, vestibule of vagina, bulb of vestibule and the greater vestibular glands. These are the organs of a female that is under the classification of external reproductive organ. Okay. Then internal reproductive organ means the uterus. Okay, uterus, the ovaries, the fallopian tubes and the vagina. Idana ഏറ്റവും important ആയിട്ട് വരുന്നത്, the uterus, ovaries, fallopian tube and vagina. So next is about the secondary organ or the mammary gland, that is known as breast. Okay, so from all of this area you got the question like this: what is uterus, what is ovaries, what is fallopian tubes? Okay, 3 areas are important. Uterus, the structure of the uterus.
This one.
Okay, this is the female external genitalia. Then the structure of the uterus, it is important. You can draw the structure of the uterus. So I will draw the structure of the uterus. Then I will tell you what is the things we need to remember. Uterus is a thick-walled, pear-shaped organ, hollow muscular, same like our heart and stomach. It is a hollow muscular organ situated in the pelvic cavity. Where it is situated? It is situated in the pelvic cavity. Okay, pelvic cavity with the urinary bladder in the front and the rectum behind. Rectum back urinary bladder ഫ്രണ്ടിലായിട്ട് നമ്മുടെ പെൽവിക് ക്യാവിറ്റിയിൽ ഇരിക്കുന്ന പിയർ ഷേപ്പ്ഡ് ആയിട്ടുള്ള ഒരു സ്ട്രക്ചർ, ഒരു ഓർഗൻ, ഹോളോ മസ്കുലർ ഓർഗൻ, അതിൻ്റെ പേരാണ് യൂട്രസ്. ഓക്കെ, what about the dimension? Dimension, the uterus is, the length is 7 to 8 centimeter length. Okay, remember 7 to 8 centimeter length, and the width is about 2 to 3 centimeters, and the weight is approximately 40 to 50. In a normal female, it is about 30 to 40 grams. What are the part of uterus? Part of uterus, they have two major parts. One is the expanded superior, divided into the body. Second, cylindrical. The 1/3 that is called the cervix area. Okay, uterus in the area. Okay, explain. This is the structure of a uterus. So structure, this is known as ovary. Okay, this is known as ovary. Okay, next this area, it is known as a fallopian tube. This area, it is known as fallopian tube. Clear? Fallopian tube. And in this area, it is known as a fundus. Clear? Fundus. And this area, it is known as body. Clear?
Body of the uterus.
Body of the uterus. And this area, it is cervix. It is cervix. Okay, and it is the external os, and last area, that is vagina. Okay, clear? So when you are explaining about a uterus, remember that 2 ovaries, 2 fallopian tubes, fundus, body, cervix, external os, and vagina. Clear? What are the other things we need to talk about? Some position and support of the uterus.
When it comes to the position and the support of the uterus, uterus is completely within the pelvic and the pelvic cavity, normally adverted into the anti-flexed position. The position will be anti-flexed position, and the long axis of the cervix has been forward over the long axis of the vagina, is called as anteversion. Okay, so it is going to be anteverted in the position. Next one is support. Support of the uterus. Uterus is a mobile organ for the mobility, and the muscular support for fibromuscular ligaments and the peritoneal ligaments will be going to be support the uterus.
Okay, support of the uterus, sometimes it is important. Just to remember that in the future purpose also it is important. Okay, because GNM students basically in their third year OBG nursing, they need to learn more about, compare with BSc nursing, they are studying lot in midwifery area. So this parts anatomy you should study thoroughly, so you will get good mark or good understanding in the future also. Hi. Mammary gland and breast.
So they will ask only the structure, either they may ask structure or they may ask the functions of the mammary gland.
Okay. When it comes to that is about the female organ. Then when it comes to the male reproductive organ, the main reproductive organ that include internal organs and external organs. External genitalia or external organ that include some organs that are the penis, scrotum, testes, and epididymis, and the spermatic cord. These 4 organs are in the part of external male reproductive organ. Then internal organ include the vast difference of ductus difference or seminal vessels, ejaculatory duct, prostate and the urethra. Okay, prostate. So here the prostate is the important area. Penis and testis. Penis it is not important in the examination, and the testis it is little bit important, but the structure of the testis also it is important, like this.
Yes, ma'am.
One structure. Okay. And the mainly prostate. Prostate, what is prostate?
It is the
Prostate
largest accessory gland of the male reproductive system. It is a fibromuscular glandular tissue. It secretions the odd volume of the semen. Okay, so you
regarding the prostate mainly, I'm also a medical surgical area, so that's the reason I remember prostate. BPH is the disease condition related with the prostate, benign prostate hyperplasia. It is very common in males. Okay, so they have experiencing difficulty in urinating. So that maybe they are confusing with the cancer. Actually, this is not a cancer. One condition it is there. Okay, in future we will learn about that. A nervous system. So nervous system, same like a ma'am told earlier, autonomous nervous system and ANS and CNS.
Okay. Central nervous system.
Then here the portion which is important means the brain it is important. Clear? Male reproductive system is there or not? For example, male reproductive system is there. Reproductive system, one of the unit you have in that reproductive system, male reproductive system and female reproductive system important. Okay. Reproductive system only for female, not only for the female, it have male also. Okay.
Both system will be come in one particular system. That is what reproductive. Both female and male will be included within it. Okay.
Within reproductive system.
So don't be confused. Both are there. Now only we are telling. Then the nervous system will be
cranial nerves. Cranial nerves, one study tips. The velvet touch, like that one study tip I told in my last video. If you haven't watched that video, watch the video.
Yeah.
Okay, because the time is
very short.
Very short, that's the reason. And sometimes you will get a question like that, what is the name of first cranial nerve? Or list the 12 cranial nerves. Otherwise, the second cranial nerve name, like questions is there.
Okay, either they may ask for the fill in the blanks type of questions. Already we have discussed about the sensory organs also, sense organs. So this is also one of the important, but we never saw any kind of questions from this unit.
Which one?
Sensory organs.
Sense organ?
Sense organ.
In the sense organ, the question it is like external ear question it is there. Essay question was there. Like
for GNM,
for GNM. Like external ear explanation and one part explanation and explanation of the eyes. Like that is there. Sense organ that is
for BSc they will not ask much
BSc
more.
They are not asking, but GNM
they will ask from this unit.
Like smell sensation. Okay, next.
So the smell sensation and eye, nose, and we have sensory organs like we have to go through here. The important thing is that the middle ear, okay, the ear, full ear, you have to draw and you have to explain the functions of the hearing, and you have to go with the cranial nerves also, means olfactory receptor cells, because the smell. Okay, so that also here it will come for a fill in the blanks type of question, and the mechanism of the smell, how it will be we are recognizing the smell, that is also important. The sense of hearing, that is also important, and the external features of the ear and as well as the structure of the ear is also important. And we have to go with the cochlea, so that is will comes in the ear only. And eye. Okay, so you are going to study about the eye.
The structure of the eye.
Eye and its function also very important. And regarding the
okay, that is about the basic anatomy. So complete syllabus we are revised here. Okay, so if you haven't watched the previous means from the beginning onwards, if you haven't watched means watch. Okay, and now we are going to tell about the important question.
According to
important questions. Okay, so are you ready? So before that, regarding the explanation or the revision, if you have any concern or doubt, means right here. Uterus or menstrual cycle, one will sure, yes. Your menstrual cycle in the physiology portion, menstrual cycle, it will come. Okay, so we are basic anatomy, we are taught this, so that's the reason. Okay, next. Okay.
Heart also we have to draw in pen only.
Yes.
Heart, kidney, lungs, whatever you want to write, you have to write in the pen only. Should not write in the pencil. It is not going to be visible. Everybody are using pencil in the examination. Don't use. For putting single line also, don't use. Else people don't mistake this one. Draw in the pen. Label in the pencil, should not do that. That is also, again, it will be affected.
And also for general, as like a general instruction, I saw that in the last time people watching our BSc videos in the live session, but they are confused because students, it's a semester based live session, no? So from the Kerala students under, they are studying QHAS, their students also watch the videos, and the students under Rajiv Gandhi University also watch the video. And we told that you should everything point out, we need to draw like that. Okay, so നിങ്ങൾ കുഹാസിൽ പഠിക്കുന്ന ഒരാൾക്കാരാണെങ്കിൽ ദയവ് ചെയ്ത് അണ്ടർലൈനിങ് ഒഴിവാക്കുക, അതുപോലെ ഇങ്ങനെ മേഘങ്ങളൊക്കെ വരച്ച് വെച്ച് മാർക്ക് ചെയ്യുന്ന പരിപാടി അവോയ്ഡ് ചെയ്യും. ബിക്കോസ് അതൊരു മാൽ പ്രാക്ടീസ് ആയിട്ടാണ് കുഹാസിൽ ഇതുവരെ കാൽക്കുലേറ്റ് ചെയ്തുകൊണ്ടിരിക്കുന്നത്. അങ്ങനെ നിങ്ങൾ കുറേ പടമൊക്കെ വരച്ച് ചെയ്താൽ നമ്മുടെ ആൻസർ ഷീറ്റും റിസൾട്ടും വിത്ത്ഹെൽഡ് ആയി പോകും. സോ അണ്ടർ രാജീവ് ഗാന്ധി യൂണിവേഴ്സിറ്റി ഹെൽത്ത് സയൻസ് മാക്സിമം ഹൗ മച്ച് യു ക്യാൻ ഡ്രോ, യു ഡ്രോ ഇറ്റ്. ഓക്കെ, യു വിൽ ഗെറ്റ് എ മോർ മാർക്ക്. പക്ഷേ കുഹാസിലാണെങ്കിൽ ഒന്നും വരയ്ക്കരുത്. അതാണ് അതിൻ്റെ ഒരു ഡിഫറൻസ്. സോ ഞാൻ ഫസ്റ്റ് ഐ ഓൾസോ മേഡ് ദാറ്റ് മിസ്റ്റേക്ക്. ഐ സ്റ്റഡീഡ് BSc ഫ്രം Kuhas. So I couldn't able to draw any single line also. But when it comes to my MSc, so under Rajiv Gandhi, first year I written very well. Then I told I expected more mark. Then everyone is told you should draw the diagram like
schematic
this.
representation.
Representation. Then after I went for like an evaluator, that time I recognized that is important in Rajiv Gandhi only, RGHS only. Okay. So in case NEB examination also you can draw.
Yeah.
Okay, so I hope it is clear for everyone.
Pen. So we will go with the question paper analysis now.
Yes. So now the time is around 6:35. What about your tea? Had your tea? എന്താ കഴിച്ചത്? നമ്മളാണേല്
enjoying and learning.
Yes.
So that will fun with learn will makes you to understand better the things. So very first we will give the meaning of the following. In the first main or the first segment of the question, we are having meaning.
Okay, carefully listen this area. Okay?
Yeah, meaning, because first year GNM you don't know what to write and how the question paper will be. So for that reason this will be very important. So you are going to write the examination for the 75 marks, and here the solution is that you have to go through the first main meaning. No.
What tea? ചായ കുടിച്ചിട്ടില്ല?
So the meaning they will ask for 4 marks. 1 marks, 4 question will be there. So you can earn 4 marks here. The next segment is that fill in the blanks. Fill in the blanks. So this we are like here also we are having 4 questions. Each question carries 1 mark. Okay, so here also you can get the 4 marks. These are all the objective types. Okay, so here the next one is short notes for 4 marks, short notes kind of question. Next segment is short notes. So the short notes are like we are having 5 questions here. You have to answer for the 4 questions. Each question carry 4 marks, so you can up to score 16 marks here. And the next segment is we are having answer the following. So answer the following is also one of the session. We are having here 3 questions. 3 questions you have to answer. So here they will split the marks. 3 plus 4 is equal to 7 and
That
again
is
3
essay
plus
question.
yes is equal to 8. Okay. So like that they will split and give you 4 questions will be there. You have to answer for each of the following. Okay. So the next part we will go with the state whether true or false. Okay. So the fifth main is again
True or false type of
will be there. So this is the objective kinds of questions. So here we have 4 questions. 1 marks will be there for each question. 4 marks we can get here, and again short note. Okay, so again we have a short note segment. Write a short notes. So short notes also 4 questions. Again 4 questions into 4 marks will be there for each question. Then 16 is the earning points. Seventh main again the answer the following. Answer the following will be there. So here long essay type of question.
Answer the following same like that.
Yeah.
Repetition.
4 plus
Short
9
notes.
and 3 plus again.
Not every time it
3
is
plus
not the
7.
same like that.
Okay, 8 plus 7 like that they will divide.
So this is the question paper pattern.
So this is the question paper pattern. Here we have to know about the first main, that you have to clear with that whole are writing the first time. No, you have to thoroughly know about this meaning. Okay, the meaning, the terminology they will ask, only write the meaning. Okay, so 3 to 4 line or maximum 5 to 6 line you write. 2 meanings you can write. Okay.
Meaning, for example, for meaning question means, for example, they will give like question like that, anatomy, physiology, terms only. So what is anatomy? Anatomy is the study structure of the human body. You write like that, you will get 1 mark. Total 4 question is there. For each question carry 1 mark, total 4 mark you will get. That is the first type of question, meaning the questions.
And the next one is for fill in the blanks. Here also you are getting, they will ask the question, you have to fill the particular blank, and each question carries 1 mark. 4 question will be there. Short notes, you have to elaborate your answer here for 4 marks.
And also one more thing you need to remember regarding this filling the blanks. In the filling the blanks question, the people sometimes the students they will write a complacent. It is not necessary. So where the answer it is there, just
put the question number and
write the answer only. For example, dash is the largest organ in the human body. So dash is the largest organ in the human body, which is the skin. So just write the answer skin only.
Skin is enough.
Skin
okay.
only. So otherwise again you are rewriting the question means time waste. Because for the GNS students time is limited. In the 75 mark you should write a lot of short answers and essay type
of questions will be there. So the third main, it is all about the short notes. You have to write thoroughly about the short notes, putting like introduction and elaboration of the answer, like that only you can write. The 4 marks will be there. 4 questions, and the next one is answer the following. 5 questions will be there. Anyone you can choose.
That is the important thing. Read the question paper carefully.
Yeah.
Question paper read carefully.
You have
so what
plenty
are
of
the
time.
instructions given by the question paper? You have to follow that. Okay. Any doubt regarding the GNM examination, you can write it here. In the chat also, you just write that. We will give the answers. Okay,
the next one is answer the following. This is the very, very important segment of your question paper, and you are going to answer like 7 marks type of question, 8 marks.
Consider with the BSc, this is the essay question for the GNM.
Long essay type of question. And again, we have a true or false. Okay. Here also already ma'am informed in that fill in the blanks how we need to write the answer. No, whether it is a true, only write true. Whether it is a false, write false. Okay. No need to go with the deep question and all that.
For example, one question like autoclaving, that is the method of sterilization.
Whether it is
it is true means you write it true.
Only. Yeah, it is true only. True.
So autoclaving, it is a method of sterilization. That is true. So you can write it true. So and also sometimes you will get a question like that. Autoclaving, that is the method of disinfection. That is false. Okay.
The next one is short notes. Short notes, again you have 4 questions here also. So this is also one of the eye yielding sector of your question paper. Again answer the following. So here also we have 4 questions, 8 plus 7 marks, like that kind of division will be there for the each and every question in the long essay type of question, that is answer the following. So togetherly we are going to write for the 75 marks.
Out of 75, after watching this video, how much they need to score?
They can score. They can score up to 60 and above.
60 and above you will get.
If you properly watched and if you properly follow the steps. Okay, and after we will tell about the paper presentation also. So all the things you are following, definitely you will get the good marks only.
And some basic instruction regarding examination also give.
Yes, ma'am.
Because
See, very first we have to go in time, prior time, before the examination we have to reach the examination center. Okay, go with the
At least
ID
1
card.
hour before you just reach
See,
the
for
examination.
that reason,
Basically, Gnm examination, every colleges don't have centers. So center in the different area. Okay, so that is this time or last time onwards, everything like that only. So maybe in your own college you couldn't able to write the examination. You will get another examination center, especially allied science areas. You will get like an examination center. So reach your college where they as per their instruction. Okay. ഓക്കെ സോ നമ്മൾ അറിയാലോ നിങ്ങളുടെ ഓൺ കോളേജസിൽ ചിലപ്പോൾ നിങ്ങൾക്ക് സെൻറ്റർ ഉണ്ടാവത്തില്ല. അപ്പോൾ അങ്ങനെ സെൻറ്റർ ഇല്ല എന്നുണ്ടെങ്കിൽ നിങ്ങളുടെ കോളേജസ് നിങ്ങൾക്ക് ട്രാവലിന് വേണ്ട ഫെസിലിറ്റീസ് ഒക്കെ അറേഞ്ച് ചെയ്ത് തരും. സോ അതുകൊണ്ട് കോളേജിൽ നിന്നുള്ള ഇൻസ്ട്രക്ഷൻ പ്രകാരം ഏത് സമയത്താണോ കോളേജിൽ എത്തേണ്ടത് ആ സമയത്ത് തന്നെ പ്രോപ്പർ യൂണിഫോമിൽ വിത്ത് ID കാർഡിൽ ഹോൾ ടിക്കറ്റിൽ എത്തുക. എന്നിട്ട് നിങ്ങളുടെ മറ്റൊരു എക്സാം സെൻറ്ററിൽ ബേസിക്കലി അങ്ങനെ ആയിരിക്കും. ഇപ്പോൾ റീസെൻ്റായിട്ട് കണ്ടുവരുന്ന അങ്ങനെയാണ് മറ്റൊരു എക്സാം സെൻറ്ററിലേക്ക് നിങ്ങളെ കൊണ്ടുപോകും. സോ അവിടെ നിന്ന് നിങ്ങൾക്ക് വളരെ ഫീൽ ഫ്രീ ആയിട്ട് നിങ്ങൾക്ക് എക്സാം എഴുതാം. കാരണം നിങ്ങളുടെ ടീച്ചേഴ്സ് ഒന്നും അല്ല അവിടെ നിങ്ങളെ ചെക്ക് ചെയ്യാൻ വേണ്ടി വരുന്നത്. സോ കൂളായിട്ട് നിങ്ങൾക്ക് എക്സാം എഴുതാം. അതൊരു അഡ്വാൻറ്റേജ് ആണല്ലേ സ്റ്റുഡൻസിന്. ഇറ്റ്സ് ആൻ അഡ്വാൻറ്റേജ് ഓൾസോ. സോ ദെൻ ആഫ്റ്റർ ഓൾസോ നിങ്ങൾക്കൊരു ട്രാവൽ ഉണ്ട് നിങ്ങളുടെ ഓൺ കോളേജിലോട്ട് സ്ലീപ്പ് ദാറ്റ് ടൈം. ഓക്കെ, നെക്സ്റ്റ് ഡോണ്ട് ഫർഗെറ്റ് ടു ക്യാരി
hall ticket. Don't do any extra things over there. Okay, that will be again bag luggages for us only. So that is the reason ನೀವು ಎಲ್ಲ ಪ್ರಿಪ್ರೇಷನ್ ಕ್ಲಿಯರ್ ಆಗಿ ಇಟ್ಕೊಂಡು ಎಕ್ಸಾಮ್ ಹಾಲ್ಗೆ ಹೋಗಿ. ಎಕ್ಸಾಮ್ ಇರೋ ಟೈಮಲ್ಲಿ ಬಂದು ನಮಗೆ ಹರಿ ಬರೀಲಿ ನಾವು ಏನೋ ಮಾಡೋಕ್ಕೆ ಹೋಗ್ತೀವಿ ಅಂತ ಹೇಳಿದ್ರೆ ಆವಾಗ ತೊಂದರೆ ಆಗೋದು ಚಾನ್ಸಸ್ ತುಂಬ ಇರುತ್ತೆ. ಸೊ ಎವ್ರಿಥಿಂಗ್ ಶುಡ್ ಬಿ ಗೆಟ್ ರೆಡಿ before one day prior to one day.
എല്ലാം റെഡിയാക്കി വെക്കുക. ഹാൾ ടിക്കറ്റ്, ID കാർഡ്, പ്രോപ്പർ യൂണിഫോമിലായിരിക്കണം കേട്ടോ നിങ്ങൾ പോകുന്ന യൂണിഫോം.
Don't wear shoes and all.
Normal chappals. Normal shoes avoid ചെയ്യുക. ഷൂസ് ഒക്കെ മാൽ പ്രാക്ടീസ്.
ID card
ആൻഡ് ലോങ് ആയിട്ടുള്ള ഷർട്ട്സ്. പിന്നെ ക്ലൈമറ്റ് ഈസ് വെദർ ഇറ്റ് ഈസ് ലിറ്റിൽ കോൾഡ്. So that's the reason students are wearing sweaters
and all. They will definitely make us to remove there itself. So for that reason remove and go priorly. That means no miscommunication and no misconception during the examination time. Okay, so that will makes you to feel burden or feel stress and fear. That anxiety will be there. So for that reason and go to the examination and go to washrooms and go. Why? Because in middle of the exam you people are telling they will not leave you to go.
Yes.
For that reason.
Otherwise that teacher also will accompany with you. So we are also facing that problem.
If you people wants to go, we have to alert a male faculty again with you to go and female faculty again with faculty. Like that kind of things will be there. Finishing off your personal work.
You are under camera.
Yeah, it's there. That camera will be there. Invigilator will turn that side. I can speak with my friend. It is not like that. You are in the observation of the camera under the university. So better.
Yes, invigilators are there and also supervisors are there. Exam observer
squad will become flying squad will be there.
Squads are there. ഇവരെല്ലാം വരുന്നത് നിങ്ങളുടെ എക്സാം പ്രോപ്പർ ആയിട്ട് നടക്കുന്നുണ്ട്, നിങ്ങൾക്ക് എല്ലാ വിധത്തിലുള്ള ഫെസിലിറ്റീസ് ഓഫർ ചെയ്യുന്നുണ്ട് കൺഫേം ചെയ്യാൻ വേണ്ടിയിട്ടാണ്. സോ ഇതൊന്ന് സ്ക്വാഡ് വരുന്നതൊന്നും നിങ്ങളെ ബാധിക്കുന്ന കാര്യമല്ല. അതെല്ലാം ടീച്ചേഴ്സ്, ഇൻവിജിലേറ്റേഴ്സ്, കോളേജ് അതോറിറ്റീസ് ഒക്കെ മാനേജ് ചെയ്തോളും. സ്ക്വാഡ് വന്നു നിങ്ങളെ ഒന്നും
you do your work that you have to answer to your question paper. That's it.
So here in the examination hall 3 hours who is the king? The students are the king.
Yeah, you have to face your battle. You have to play in the battlefield. That is what nothing is there. If you study properly then you can attend. So yes. Next we can
study properly means you are watched. നന്നായി വാച്ച് ചെയ്തിട്ടുണ്ടെങ്കിൽ നിങ്ങൾക്ക് പാസ് ആവും.
Please tell mostly important questions.
അതല്ലേ പറയാൻ പോകുന്നത്. Yes.
Now we will go with
ആദർശ് ആദി റോജിൻസ്.
Only lungs is important. No, everything is important.
They're asking lungs only, not only lungs, everything. Okay, so now this is the time for the exam question paper prediction. Okay, so exam question paper prediction. നമ്മൾ പറയാൻ പോകുന്നത് നിങ്ങൾക്ക് ഇത്തവണത്തെ എക്സാമിന് വരുന്ന ക്വസ്റ്റ്യൻസ് ആണ്. സോ ഈ ക്വസ്റ്റ്യൻസ് നിങ്ങൾക്ക് ക്വസ്റ്റ്യൻ പേപ്പറിൽ കാണാം. ഓക്കെ, സോ അപ്പോൾ നമ്മൾ
according to the analysis of the previous year question.
Then one word question or true or false questions ഒന്നും നമ്മൾ ഇങ്ങനെ എടുത്തെടുത്ത് ഇതാണ് വരുന്നത് അങ്ങനെ പറയില്ല. പക്ഷേ ഏറ്റവും ഇമ്പോർട്ടൻ്റ് ആയിട്ടുള്ള ക്വസ്റ്റ്യൻസ് ഇപ്പോൾ പറയും. സോ ഈ ഒരു ക്വസ്റ്റ്യൻസ് നിങ്ങൾ ലിസൺ ചെയ്തിട്ടുണ്ടെങ്കിൽ ഡെഫിനറ്റ്ലി you can first essay question ആണ് സ്റ്റാർട്ട് ചെയ്യുന്നത്. സോ വി ക്യാൻ സ്റ്റാർട്ട് വിത്ത് essay question. essay question means 3 + 4 = 7 എന്നൊക്കെ പറഞ്ഞ് നിങ്ങൾ കണ്ടില്ലേ, ആൻസർ ദ ഫോളോയിങ് ക്വസ്റ്റ്യൻസ്. ടോട്ടൽ യു വിൽ ഗെറ്റ് 4 essay questions. 4 total 4
questions will be there, like 8 and 7 they will distinguish.
Approximately one question they carry 8 or 7 and other questions are there that 4 questions, not to 4 plus
3 plus 4.
3 plus 4. No. 4 plus 4 for 8 questions are there that carry 4 marks. Okay. So, ഇത്രയും ക്വസ്റ്റ്യൻസിനുള്ള ചോദ്യങ്ങളാണ് ഇപ്പോൾ പറഞ്ഞു തരാൻ പോകുന്നത്. The first question that is about define. No. First question ഞാൻ പറഞ്ഞു തരാം. Okay, ഫസ്റ്റ് ക്വസ്റ്റ്യൻ ഞാൻ പറയാൻ പോകുന്നത്. നിങ്ങൾ നോട്ട് ചെയ്ത് വെച്ചോ. Okay, then the first question that is about digestive system. List the organs of digestive system and explain the structure of stomach. List the organs of digestive system. ഡൈജസ്റ്റീവ് സിസ്റ്റത്തിൻ്റെ ഓർഗൻസ് എക്സ്പ്ലെയിൻ ചെയ്യുക. നമ്മൾ പറഞ്ഞില്ലേ, എക്സ്പ്ലെയിൻ ചെയ്ത് പറഞ്ഞു ഡൈജസ്റ്റീവ് സിസ്റ്റത്തിൽ ഏതൊക്കെ ഓർഗൻസ് ആണുള്ളത്. ദെൻ ഒരു സ്റ്റൊമക്ക് ജെ ഷേപ്ഡ് ഹോളോ മസ്കുലർ ഓർഗനെ കുറിച്ച് പറഞ്ഞില്ലേ. അപ്പോൾ ഇതെല്ലാം പറഞ്ഞു. അപ്പോൾ സ്ട്രക്ചർ ഓഫ് ദ സ്റ്റൊമക്ക് എക്സ്പ്ലെയിൻ ചെയ്യാൻ വേണ്ടിയിട്ടാണ് നിങ്ങളുടെ ഇത്തവണത്തെ essay ക്വസ്റ്റ്യൻ ആയിട്ട് വരാൻ പോകുന്നത്. സോ ദിസ് ഈസ് യുവർ essay question. This is your essay question. List the organs of digestive system and explain stomach in detail. Okay, so that is one of the question. Sometimes you will get this as an essay question, means a 3 plus 4 7 mark question, otherwise for the 4 mark question. Okay, so in that additionally you will get like a 1 word questions also. Okay, like how much the weight and all, like a 1 word questions also you will get. Okay, next question, next important question, that is about excretory system. That is from the excretory system. Define excretory system or explain excretory system and explain in detail about the function and composition of the urine. Function and composition of the urine means 3 plus 4 7 mark you will get from this area. Composition of the urine means the formation of the urine. Urine formation, it is a portion from the physiology. So in that area you maybe get a 1 question. Anatomy ഒരു 2 question, physiology ഒരു 1 question and microbiology 1 question. Essay question like that you will get in this year question paper. 2025 December 29th എക്സാമിൽ ഇങ്ങനെയായിരിക്കും ക്വസ്റ്റ്യൻസ് വരുന്നത്. ഓക്കെ, സോ നെക്സ്റ്റ് വരുന്നത് നെക്സ്റ്റ് ക്വസ്റ്റ്യൻ excretory system and
digestive system.
Excretory system and digestive system we are covered. Next is about the list the muscles of the head and neck. List the muscles of the head and neck and explain the functions of the muscles. Explain the functions of the muscles and list the muscles of the head and neck. Okay, that is one question we can expect. Okay, next question from the sense organ. In the sense organ, that question it is like that. Draw a neat diagram of the ear and explain physiology of hearing. Draw a neat diagram of the ear. Just to mention ear like that. Okay, ear and explain the physiology of hearing. Okay, from that system.
Sense organs.
Sense organ. Again you will get a question like that. Organs of hearing, it's a special sense. Name the organs of the special sense and okay, ear, physiology of hearing or draw the diagram of physiology എന്ന് ചോദിക്കും കേട്ടോ. ചിലപ്പോൾ എക്സാം മാറ്റാൻ ചാൻസ് ഇല്ല. ചാൻസ് മാറ്റുമോയെന്നറിയില്ല, chance കുറവാണ്. Okay, next question about endocrine glands. List endocrine glands and describe the structure of thyroid gland or otherwise pituitary gland. 2 glands. From 2 glands, endocrine glands in 2 ആയിരിക്കും വരുന്നത്. ഒന്നെങ്കിൽ thyroid gland, otherwise pituitary gland. List endocrine glands and describe the structure of thyroid gland and pituitary gland.
Describe the structure of the thyroid gland and the pituitary gland. Okay, yes. Again it is very important.
Then we are talk about the excretory system. Same thing again, some changes it is there, but the question it is same. You will get like this: draw a neat labeled diagram of urinary system and explain the functions of kidney. Explain the functions of kidney. Clear? Okay, so that is one of the question. Next is about the draw a neat labeled diagram of heart. Draw a neat labeled diagram of heart and explain pulmonary circulation or otherwise explain conducting system or explain systemic circulation. Okay, here 3 different types of questions we can explain from this circulatory system. First is draw a neat labeled diagram of heart and explain pulmonary circulation or conducting system or systemic circulation. I noticed one student already pulmonary circulation, he noticed that this is the important area. Yes, that is an important area, pulmonary circulation and systemic circulation. One area it is there, you will get a question like this. Okay, next about the bones from the osteology area. If you get a essay or short answer question, that question it is like that: bones of the upper limb or the structure of humerus or structure of the femur bone. Okay, structure of the femur bone or humerus or the upper bone means the structure of the long bone. Okay, that is an important area. Next is about the again organs of digestive system and explain the structure of the stomach. Then
again organs of the nervous system and structure of the brain. Before going to that, organs of the digestive system
and the structure of the stomach and sometime same like organs of the digestive system and they will ask draw a neat labeled diagram of the liver
and their functions
of the liver. Okay,
so there is a chance to ask that liver also. The next one is organs of the nervous system and the structure of the brain also they may ask. Okay,
question
this is a very important question in the nervous system. So neurons also you have to write and brain also you have to
organs of the nervous system and the structure of the brain. Okay, structure of the brain, remember.
So remember, don't forget to write. And the next one is
not that one. Joint. Describe.
Describe the joint and classify the shoulder joints. When it comes to skeletal system, students identify that where they are getting the longest type of questions: skeletal system, nervous system, digestive system, and again we are getting from the circulatory system and endocrine, excretory also. Okay,
yes. So there may be chances. Question is like that: describe joint and classify joint. Explain more about the shoulder joint. Shoulder joint means it is a ball and socket joint. Correct.
Yes, ma'am.
Yes. Okay.
The next one is define cardiac cycle and the stages of the cardiac cycle.
Cardiac cycle or stages of cardiac system, which is one of the question you can
see. We told that is system. Not much important, but we never told that should not neglect. Okay, so kindly go this also. Define cardiac cycle and the stages of the cardiac cycle. It is very simple question. You will learn very easy.
And also we are explaining about the skin. That question it is there. Yeah. Draw a neat labeled diagram of skin and explain the functions of skin.
Yeah.
Yes,
skin is also one of the important, and the name the organs of the special senses, explain the physiology of the hearing.
Yes, that is the second time it is repeatedly asking name of the organs on the spatial sense and explain the physiology of hearing. Okay, so it's okay.
So this is repeated, and the next thing
physiology of hearing and also eyes, that is important. Okay,
eye is also important. Then list the types of tissue and explain the functions of the muscular tissue. By the time you have to list it down and you have to explain the function.
List the types of tissues and explain the functions of muscular tissues. In the starting of the class, we are explaining about that tissues.
The entire classification flowchart will come now. That you have to explain thoroughly. Okay?
Yes.
So in one classification flowchart, we can come to explain everything.
Okay, so that is about anatomy essay questions, but not only anatomy and physiology, one more area it is there, that is microbiology. From microbiology, you will get one essay question. That essay question, it is that from the microbiology area, you will get one essay question. That essay question I will tell now. Describe the factors affecting the growth of microbes. That may be one question. Okay. Describe the factors affecting the growth of microbes, or explain detail regarding the mode of transmission of infection. Explain in detail regarding the mode of transmission of infection. That include the source of infection. Okay. Then otherwise, for like a 5-mark question, you will get like this: source of infection, or mode of exit and transmission of diseases, or then prevention of measures to take the prevention of cross infection in that infection region. Definitely you will get a 5-mark question, otherwise a 10-mark question. Okay, clear? Then and one more question we can expect from the microbiology region, that is about sterilization. Okay, sterilization. Explain sterilization and method of sterilization
And the techniques.
Yes, in that sterilization, one special area if they are taking means that is autoclaving. What is autoclaving? Otherwise, for 1-mark question also is autoclaving. What is autoclaving? It is a disinfection or a sterilization. It is a method of sterilization. And another one question from the microbiology, that is about define asepsis. Okay, define asepsis.
Yeah, this is also one of the very important topic, that is asepsis.
Asepsis.
So we have a
method of medical and surgical asepsis. Okay, so that is one question we can expect from the microbiology. Okay, so these are the questions as like an essay. Very important area. Very important questions we discuss. Very important questions. But not only these questions. You will get short questions, short notes. Yes, 4-mark questions are there. Short note. For the short note, what are the questions?
Structure of the breast.
Okay, once again tell me.
Again, don't be confused. Now we are going with the short notes. Okay, short note type of questions. Here we are expecting the structure of the breast and ball and socket joints.
Like this, one by one we will tell you structure of the heart. Structure of the heart. Okay, means I draw one diagram here, so you can use that one. Next is joints. Regarding the joint, ball and socket joint, shoulder joint. Okay, from the joint area, one question. Then the structure of the brain. Structure of the brain is one area that we can expect one question. Okay, simply just brain like that you write. Completely writing it is difficult. Okay, so we know that bioscience, that include anatomy, physiology and microbiology. So in the microbiology area, you will get some short answers and one essay question and some 1-mark question also. For the short answer from the microbiology area, infection is one of the very important area you will get question, and also that infection.
Nosocomial infection. So the nosocomial infection, which will called as a hospital acquired infection. Okay, don't be confused if they are asking about the hospital acquired infection and the nosocomial infection, both are same only.
Okay.
The infection which is affected or getting from the hospital, we will call it as a nosocomial infection. This is one of the very big and very unique area to learn very better, because you are the frontline workers to know about this one.
Nosocomial infection, from the infection area, nosocomial infection, it is a 4-mark question. And same like that, source of infection may be a 4-mark question. Okay, next hypersensitivity. In microbiology area, hypersensitivity reaction, allergy reaction, that is an area. So the classification of hypersensitivity, they may be get like a 4-mark question.
And structure of the cell.
Yes,
structure of the cell, uterus and the ovary.
Structure of the cell, structure of the
uterus, structure of the ovary. Okay. So togetherly they will not ask structure of the cell, structure of the uterus, structure of the ovary. So there may be, you will get in the 4 mark short notes. The next one we are expecting the connective tissue. Okay.
Tissue, it is like a essay question also. Essay, we told that what essay, what question, how it may be asked. So same like that, if you haven't get a question like an essay, we can expect for the 4 mark question, that is connective tissue. Connective tissue, epithelial tissue. These are the very important tissues we need to study. Then regarding the muscles in the face, one time it is like a question, it is asked muscles in the face.
Name the muscles of the faces. Okay, you have to write the short notes. Okay, where you have to name it and you have to elaborate the answer
then
also.
The sense organ.
Sense organ,
hearing. For the essay question, hearing they will ask, and structure of the
ear they will ask in the short note. Okay, the next one, structure of the pancreas in the digestive system. They may chance to ask regarding the pancreas.
It is repeatedly asking.
Then functions of the
skin. In the essay question also we mentioned that the skin, functions of the skin and the structure of the skin. And for the 4 mark question also, functions of the skin we can expect. Then regarding the respiration, that was one essay also. Respiratory system, structure of the lungs and physiology of respiration. Physiology of respiration. Okay, physiology of respiration. Remember.
So physiology of the respiration and the structure of the lungs we are expecting from the
function of the skin. Physiology of the respiration.
Yeah. The next one is we are having the functions of the liver. This is very important. Practical also they will ask.
Liver and function paranille. So ഇതിനകത്ത് ഇത് essay ആയിട്ട് വന്നിട്ടില്ലെങ്കിൽ എങ്ങനെ വരുന്ന functions of the liver മാത്രം detoxification പറഞ്ഞില്ലേ?
The production of the bile and like absorption of the vitamins and all will be there, no? That only. Blood group and the functions of the blood. Okay, the group of blood
unit
and
blood ഉണ്ടല്ലോ നമ്മുടെ unit blood, from the unit blood question it is like that, blood group or functions of the blood. Then same like one person, they are written in the comment box, menstrual cycle, it is important. Yes, menstrual cycle will ask as a 4 mark question. Okay, so then cranial nerve for 1 mark and also for 4 mark. Then process of the urine formation. In the essay also I mentioned that structure of the kidney and urine formation. Urine formation is a question. Then regarding the bones, innominative bones, I show that innominative bone is one of the 4 mark question is asked. Same like a synovial joint. Have you remember I draw the picture of the synovial joint here? So that picture you should draw there. Okay, then regarding sometime the 4 mark question like that, structure of neurons, structure of lung, structure of pituitary gland, structure of cardiac cycle, like that questions.
Full structure they may ask, or they may ask the functions. Okay, so these are the 4 marks questions which we can expect from the anatomy and physiology, that is what bioscience. Next we can move with the
yes, and then one
microbiology.
And it's, I think it is not covered. Female structure of neuron,
structure of the female reproductive system, lungs,
structure of the
lungs, structure of the pituitary gland, and the structure of the cardiac cycle. So this cardiac cycle also, which will be explained in the a flow chart. Okay, so that you have to write. The diagram is there. Okay, the next one is structure of the spinal cord. This is very important. Then structure of the brain.
Brain, so not only brain but cerebrum, it is important. And sometimes you will get question teeth, symbol teeth, and also simply tongue. Okay, next structure of the eyeball, from the sense organ questions like that, hearing and eyeball. Next functions of the pancreas, sometimes it is structure of, sometimes it is functions of. Functions of the pancreas,
functions they are asking, that is from the physiology. Structure they are asking, that is from the anatomy. So that is how you differentiate and study. So while studying only, both you study. Okay, whatever they may ask also you will write.
Okay, functions of the pancreas
and the functions of the kidney and functions of the blood, functions of the liver, and one more thing, in the blood they may ask for, regarding the components of the blood also. So that is also very important.
Okay, when it comes to microbiology, what is microbiology? Microbiology is the study of microbes. Again and again, microbiology question you will get like that. What is microbiology? Define question. 1 mark question is there, 4 mark question is there, and also for essay question is there. So here most important questions are essay question. I already mentioned. The same question only you will get it. Don't worry. The same question only you will get. Okay. So here classification of bacteria.
Yeah, the classification of the bacteria is also one of the important question you may expect in the short notes. And regarding the cold chain is also one of the important. So the next one is bacterial cell. Morphological representation of the bacterial cell. Okay, you have to draw the diagram here. Then again nosocomial infection. So or else hospital acquired infection is also one of the question. Then
microscope.
Regarding the functions of the microscope, and they will not ask regarding the structure. Microscope functions only they will ask. Why we are using visualization? Because the microorganisms are the organisms which we can't able to see in our naked eyes, right? With the help of the microscope only we are visualizing. So that is the thing you have to write. Then we are going to write about the carbohydrate metabolism and
that is what I also
nutrition.
confused that. I confused. Is it exactly from this area? Yes, exactly. One question was the carbohydrate metabolism.
Oh, it is from here.
Okay, factors influencing
Factors
the growth
of microorganism
and
specimen collection is the one of the things which we can expect.
Okay, so give the meaning. So when it is, I got a call. Okay, so for one word questions, sure question, that is anatomy, microbiology, physiology, and one more sure question or 2 questions I will give you, that is immunity and fertilization, autoclaving, immunity, sterilization,
disinfection, they may ask cold chain.
Okay,
see, terminology, whatever, how much it is there also you study terminology from 4 marks you will definitely get from that. So no need to regret any things which is in the terminologies, okay.
Okay, these are the questions you will get on this year examination. Any doubt you can write it here. Any additional assistance you can write it here. Okay, and also tomorrow we know that as per your instructions we are conducting one class, that is at the child health nursing class tomorrow at 5 o'clock. We will conduct, Manoj sir will take the classes. So for the BSc students, if you are Gnm students, if you are staying in the hostel, just inform to your
BSc friends.
Friends also. We have tomorrow live class. Okay, so this is regarding the first year bioscience. Again, I don't know how much it is possible to conduct the first year live classes. Anyway, we will try to conduct live classes because first year students, second year, third year students are there. They have exam on the same time. So it is not possible to conduct for everyone at the same time. Okay. So then also people, they will mistakenly they will join the classes and they lost their times and all. So that is the reason you should check with our Instagram page. Okay, Instagram stories. Daily update will be there in the Instagram story. Nursing Guru official Instagram page. If you haven't followed me, so follow it now. Okay, share with your 2 or 3 friends. And also, if you haven't downloaded Nursing Guru app, download it and use the application. And also the YouTube channel. Subscribe
to our YouTube channel. If you have
and
any
also
doubt,
enable the bell notification. Okay.
Yeah.
Otherwise, what will happen means you won't get any notification.
Yes.
When the live class is there, you won't get any notification. So enable that. Ting ting ting.
In our time when we are studying, we struggled a lot to know the informations. Okay, nowadays in our channel we are providing each and everything, that also in a free of cost. You will, wherever you will be there only you are getting the information, right? So kindly subscribe and you are putting a bell notification.
And message.
Yeah, you can message here. And you can put a comment also. We will reply for that and go through the Instagram updates. Okay, whatever it will be there, we are informed in Instagram our page, and definitely you will get and you will come and attend our classes. Definitely, for sure, you will be happy in the examination.
Okay, anyway, you have exam. Mostly, we hope we will conduct the exam will be conducted from 29 onwards. Any changes in the timetable means we will update through the Instagram. So follow us and keep watching our lives. If you feel it is useful, definitely share with your friends. Clear? Or any personal assistant, any mentorship or anything, you can contact us at any time, not any time, through our WhatsApp 6282650553 is our number. So you can contact at 10 o'clock to 6:30. So in between, teachers are available. They will give the reply. They will guide you through in a better way. Okay, clear? Hope it is clear for, I hope this examination, this bioscience examination will be easy for all nursing guru students. Okay.
Definitely.
So we hope like that. So again and again from nursing guru team and from our bottom of our heart, we wish all the best for your future and also for your examination. Okay, all the best. After the examination, if you got this question, means remember us. Again, come back and comment.
Put a comment here.
Okay. Bye bye. See you.
Thank you. Thank you, one and all.